It's February the 19th, Friday. Again, regretfully, but at the same time, optimistically, I have to report to you we've lost 23 additional West Virginians. It's hard to believe we're saying that that's optimistic or optimism. You know, it's tragic beyond belief. We all get that. We all know that. But where we've been and where it looks like our numbers are trending and everything, in fact, it looks absolutely so much better. We don't want to let any of these people go and just become a number or a statistic, as I've said 1,000 times. We've got to absolutely keep these families in your thoughts and your prayers, and absolutely all of their loved ones in each and every way. You know, this tragedy of losing a loved one to this dreaded killer is just plain awful. And when it really boils right down to it, a lot of times we get all wrapped up in what's going on here or there in our lives and everything, and we don't really just get the real realization that how these families really feel and how all their loved ones really are suffering. And so please just remember them. The 2,226th death in West Virginia is a 72-year-old female from Lewis County. The 2,227th death is an 81-year-old female from Upshur County. The 2,228th death is a 91-year-old female from Wood County. The 2,229th death is a 68-year-old male from Kanawha County. Now get this. The 2,230th death in West Virginia is a 101-year-old female from Harrison County. God bless all of them, but a special God bless to this wonderful lady. Our 2,231st death is an 84-year-old female from Wood County. Our 2,232nd death is a 67-year-old female from Taylor County. Our 2,233rd death, let me back up. Our 2,232nd death is a 67-year-old female from Taylor County. Our 2,233rd death is a 93-year-old male from Webster County. Our 2,234th death is an 87-year-old female from Wood County. Our 2,235th death is a 70-year-old male from Harrison County. Our 2,236th death is an 83-year-old female from Berkeley County. Our 2,237th death is a 51-year-old male from Jefferson County. Way too young. Our 2,238th death is an 89-year-old female from Mercer County. Our 2,239th death is a 76-year-old male from Kanawha County. Our 2,240th death is a 92-year-old male from Fayette County. Our 2,241st death is an 87-year-old male from Jackson County. Our 2,242nd death is an 85-year-old male from Berkeley County. Our 2,243rd death is a 63-year-old male from Wood County. Our 2,244th death is an 88-year-old male from Wayne County. Our 2,245th death is a 91-year-old female from Mercer County. Our 2,246th death is a 92-year-old female from Mercer County. Our 2,247th death is an 87-year-old male from Jackson County. And our 2,248th death in West Virginia, a 54-year-old female from Marion County. Don't forget them. Don't forget them. The majority of these people are elderly people, and I say over and over about losing our wisdom. A couple of them are 51 and 54 years old, tragically young, tragically old. We'll miss them. God bless each and every one of them. In the first 6 weeks of 2021, we have seen now, get this, in the first 6 weeks of this year, in the last 6 weeks, we have seen a 72% reduction in the deaths from week 1 to week 6. We now have 295 positive cases that we've recorded in the last 24 hours. Our daily positivity rate's 3.12. Our cumulative rate continues to come down at 5.52. This is a wonderful number, but it can be a whole lot better, I know, but boy, what a great, great, great number this is. For the first time since November the 15th, we are less than 10,000 active cases in West Virginia. We have 9,624 active cases in West Virginia, and they have gone down now 34 straight days. Our recovered cases are 117,183. Please look at your graph, the top graph. The dark line is our active cases. The dark line, the light blue line is our recovered cases. The wider they get, the better. It's just absolutely getting better. We have 293 people that are hospitalized in West Virginia. This is the first time we've been under 300 since November the 10th. We have 68 people now in our ICU units, and we have no red counties in our state. Please pull up our map. Our map is getting prettier and prettier and prettier. Look at the green all across this map. It's absolutely doing better. I want to remind all those again over 65 that if you're 65 and older, absolutely, and you get that headache or tiredness or sniffle or anxiety, go get a test. I mean, for crying out loud, just go get tested. If by chance you would come back positive, we can give you the antibodies and make this go away absolutely with some real level of certainty. We got to get you tested. Now, I promised you on Wednesday that we were looking at lowering restrictions and everything on our businesses and our schools, and let me just take time to tell you that I think we can do this now. We want to be proactive in this, as we've been this way all along, and we're just going to keep doing exactly what we've done all along. Be cautious, be absolutely cautious, be smart, and absolutely don't panic, and do all the things that we've said all along. If I could just read that to you just 1 second, and this we said in the very, very beginning. It's not a time to panic. It's a time to be cautious. It's not a time to be fearful. It's a time to be smart. It's not a time to be weak. It's a time to be West Virginia strong. That's what we've done all the way through this whole thing. So, with my pandemic leadership team, we have absolutely had all kinds of discussions about lessening some of the COVID restrictions on our businesses and schools. And first, I want to make it perfectly clear that although the numbers are much better, than they've been in the last few months, we're still a long ways from being out of the woods. We've still absolutely got to be cautious, wear our mask, and just use good common sense. We have to reinstate restrictions. If we see that we've got another surge that comes, we will reinstate additional restrictions back if, in fact, we get in a situation where we have another surge. Also, our indoor face covering requirement is still going to be in effect. So that means if you go in a public building, you got to wear a mask. Okay, now, from our restaurants and our bars, today I am signing an executive order to increase the capacity limit for all restaurants and bars to 75% of their seating capacity. That's up from 50%, and that is only that way if social distancing can be maintained between groups as they arrive and sit together. Bars may only increase capacity to the extent that they have physical seating for every patron. No standing room for people to congregate will be allowed. Hopefully, we can remove every single one of these limitations in the next couple of weeks. Now, let me just talk to you just 1 second about that. You know, my leadership team has come to me over and over with lots of different numbers, lots of stuff. You know, I've opted out today to move this from 50 to 75%, basically, in hopes that, you know, from our restaurants and our bars, that'll help them. It'll help them, and it'll take just a little bit more of the burden off their back. And what I would tell you just this, from the standpoint of our restaurants and our bars and whatever it may be, I truly believe in the next very few weeks we'll be able to move that to 100%. Our small businesses, I am raising the capacity limitation on small businesses and retail stores from 2 people per 1,000 square feet to 4 people per 1,000 square feet, and from 3 people per 1,000 square feet in grocery stores to 6 people per 1,000 square feet in the grocery stores. So basically, I am doubling the limitation in our retail and our grocery stores. You know, and again, we know that there's a very low risk of spread with these type businesses, as long as we continue to wear our face mask. Now, from the standpoint of social gathering, we were at 100. We lowered it to 25. We're now raising it back to 75. You know, public gatherings means any gathering of people for purely social purposes. You must continue to social distance, wear face coverings, and follow all the applicable guidelines, please. As far as our schools, next week, all teachers and school service personnel over the age of 50 that have requested a vaccine will be complete with their 2nd dose. Therefore, I am calling on the State Board of Education to make it mandatory that all counties send their students in grades K through 8 back to full-time. I am also signing an executive order to clarify that K through 8 students in all counties statewide should be in school. From the standpoint of live music, I am declaring the existing prohibition on live indoor music performances. You know, I am clarifying that the existing prohibition on live indoor music performances, except for those incorporating vocals or using wind instruments, may take place indoors now, so long as the event is held in accordance with all the guidelines and all the documents that we have. As far as winter sports, I have been working with the WVSSAC. I have asked them to work with all county school boards to ensure they have occupancy rules or attendance guidelines limitations that will meet the social distancing requirements and other guidelines. I'm going to read that one more time, because this is for people that are going to come to the games, the sports, the winter sports. I have asked the SSAC to work with the county school boards and the county school superintendents to ensure that the occupancy rules and/or attendance limitations will be met in association with all the social distancing requirements and guidelines. All businesses must continue to follow all the other safety guidelines. These include mandatory face coverings and social distancing, and all guidance documents are posted on our website. I hope that clarifies a lot of stuff. I hope that gets a lot of stuff, you know, off our backs. And what we want to do is adjust, be fluid, you know, pivot all the different things that I've told you over and over and over, and our great medical, National Guard, education folks and everything, all of us feel that this is the way to move today, and this is safe, and this is what we can do today. The bottom line, everybody knows, we have to, just to tell it like it is, we had to learn to live with this. And we have to be as safe as we can possibly be, but we've got to go on, don't we? And that's what we're trying to do. As far as our vaccine distribution update, it's tremendous. We're already at 97.4% administration rate as far as the first round doses, and 94.4%, on our second round doses for the week. And our goal is to get to 100%. We'll get there. It is just amazing, the great work that's been done there. We've now got shots in arms of 413,249 West Virginians, and we have got a total of second round shots in arms of 154,798 West Virginians. We continue to lead the nation in every way. We've put in arms in the last 24 hours 7,410 doses. All we need is just more doses. That's the simple answer to this, but we're getting more. We're just not getting more as fast as what we'd like, but we're still grateful for what we're getting, that's for sure. I still want to motivate the counties to pre-register and all of our people, and from the standpoint of those 65 years of age and older, the counties, we have 5 counties. There's Gilmer, Wyoming, Mingo, Mason, and McDowell counties. We need to have more of those people participate in our pre-registration. Please do that. We now have 269,000 West Virginians that are pre-registered. If you're having trouble doing it, absolutely, just call us and we'll walk you through it. It takes about 10 minutes to pre-register, and really and truly it helps us, and it'll help you like crazy to get your vaccine. And us be able to notify you and everything else. Keep in mind too, West Virginia, again, first in the nation to put this in. You got everybody all stumbling all over themselves and everything. Just pick up, if you want some interesting reading, pick up and try to find out what Ohio's doing, or Pennsylvania's doing, or Virginia's doing, and you'll find people stumbling around like they're in the dark. West Virginia's done it, and I am very, very proud of that. As far as our Save Our Wisdom clinics, we're in all 55 counties. Got to watch about the weather updates and all that, and let me see if, of course, we don't have enough doses to do it all at one time. We all know that. We've been through that 5,000 times. The most pressing or most impressive number that I see over and over is now, because we pivoted. We pivoted at the right moment. We've got 141,186 West Virginians of age 65 and older. We have got shots in their arms. We've got 69,709 of them with the second round shots. Now, what does that mean? Really and truly, we've got 141,000 out of 350,000 total people, for all practical purposes, in our state with a shot in their arm. Now, those are the people we know are dying and have been dying like flies all across this country, and it's a crying shame. With those people having shots in their arms right now, not only are we saving their lives, but we're breaking the chain to save many, many, many other lives. We have an issue with our seniors over 65, and that is this: a participation rate of 75% sounds good, doesn't it? But that means we still are going to have a great many of our seniors that we did not get a shot in their arm. Could be in the neighborhood of 60,000 or 70,000. It's a pile of people. Go get your absolutely register and get your vaccine. Jiminy Christmas. I mean, how can you possibly listen to some taboo out there about growing antlers or whatever it may be? Just think about it. Where have you heard of people having all kinds of adverse reaction to getting a vaccine. There's very, very, very little of it. And the percentage chance of you being able to get this thing, and if you get it, you're in trouble. Get the vaccine. Please get the vaccine. Not only are you in trouble, but just think, and I don't want to be morbid in all this thought, but I just need you to know. Can you imagine, and it's happened thousands of times. It's happened across this country hundreds of thousands of times. We are within a gnat's butt right now of being at 500,000, 500,000 people have died. You realize how they died? They couldn't breathe. They were gasping for breath. Their loved ones couldn't be around them as they gasped for breath because of the COVID restrictions. You got to get vaccinated. Please get vaccinated. Okay, the COVID vaccine info hotline, you know, all that's up there and everything. You know, vaccine reminders, you can't get COVID from taking the vaccine. Just kind of encourage and help one another. And if you have somebody that's a little afraid or, you know, a little skeptical and everything, talk to them, urge them to get their vaccination. They really need to do that. Our testing, our free testing's all up there, your free, you know, your map and everything. And again, we thank the drive-through folks, you know, at Walgreens and Frith for all they've done. They've done great stuff. As far as our long-term care facilities, this number is amazing beyond belief. It just tickles me to death. We only have 21 outbreaks now in our long-term care facilities. That's wonderful. We still have one active outbreak in our church community. That's in Fayette County. We want to get that cleaned up, and we want to continue in our church community to continue to just pull the rope like you've done. I mean, man, gosh, what an amazing job. What an amazing, amazing job. So keep it up. Keep that pew in between you, and absolutely, if you can hold up just a little bit longer, really and truly, on getting your church services, you know, from going to church to getting your church services, you know, virtually or whatever like that. Just hang on with me just a little bit longer, especially if you're over 65. And we're going to get there, and it's going to be really good, really good. At corrections, we're down to 21 inmates and 11 staff cases. That's great, too. Corrections has done an incredible job. You know, I ask you just to remember all those that we lost, especially a great lieutenant we just lost recently. And we have 12 of the 21 inmate cases are at North Central Jail, and we have no other facility in the state with more than 2 active inmate cases. I tell you over and over to wear your face covering and everything. It's not much to ask, is it? It's really not much to ask. I ask you to give blood, to absolutely take the time to give blood. How does it mean? What does it mean? How much does it cost? Really, at the end of the day, you know, to give up maybe a little over an hour of your time, give blood. How much is a life worth? And it's worth so much. Really, really consider giving blood. We need it. We need it really badly. Okay, I've known about this announcement. We've held it back and everything from the standpoint of the, you know, to the wishes of the Toyota people. But now just get this. This is a great, great steward of West Virginia, and they have done phenomenal work. But today, Toyota Motor Manufacturing of West Virginia announced that they are, that due to increased customer demand, they are investing $210 million in upgrades into Buffalo plant, and that will result in an additional 100 new jobs at that location. I congratulate Toyota, and I thank them beyond belief. They've been with us for 20 years. You know, they've employed hundreds and hundreds and hundreds of great West Virginians. They've invested hundreds of millions of dollars, and they continue to grow their business in this wonderful, wonderful mountain state. All that's terrific stuff. I tell these people over and over, the great things about West Virginia are many, but one for absolute certain is this: we know how to love, but we know how to appreciate. and we don't forget. We should never forget what these great people have provided for the state of West Virginia. So I thank them in every way. I was on the call with their leadership the other day, and people from Japan and wherever, I was talking to different people. But what an incredible, incredible work that they've done. And if you've never been there, and you can, actually maybe drop in, at some point in time in the future when COVID leaves us and everything, and maybe somebody could get you in contact with somebody that could actually take you into the plant and just watch. You could eat on the floor. It is absolutely amazing, amazing what these people do. And the number of vehicles that they put out and the number of transmissions and engines is off the chart. So thank you, thank you, thank you. Last thing I have, this is last but surely not least, that Dr. Amjad's on the call, on the briefing all the time and everything, but her little dog Sammy just had a surgery at Virginia Tech, and she's bringing him home this morning. And for myself and baby dog, we're so happy that Sammy's doing good. So that's great. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning, and the governor has shared what is really good news and a reflection of the great work of all West Virginians. We know that based on the governor's priority for all of us, which was to save lives and to make sure that we maintain capacity and function of our healthcare sector in our communities, that we entered upon a priority scheme that focused on hospital workers and nursing home residents and other essential workers, and quickly also turned to our most vulnerable, and the governor created the Save Our Wisdom campaign. And as the governor said, because of that great work and because of the commitment of all of you, West Virginia, to still be very cautious and wear your mask and stay physically distanced and stay home if you can, and make sure that you're cognizant of the environments that you're in, that West Virginia has done really well. And as the governor said, we have seen a tremendous reduction in the number of deaths every week over the last 6 weeks. We see reductions in hospitalizations, reductions in ICU patients, reductions of folks on ventilators. And all in all, West Virginia is really done great through this part of the pandemic. And I think from a medical standpoint, the governor talks to all of us constantly, and we do believe, as the governor has done, that starting to have things get back a little bit more towards normal for many people is important, because we want to make sure, as this dynamic event that is COVID-19 continues to unfold, that we are constantly focusing on how we can serve the citizens of West Virginia in the best way. I do, though, want to make sure that we are also being very honest and transparent in telling people that while we are doing much better, and that is wonderful, and again, thank you to all of the great work of the folks in West Virginia, the hardworking people in the National Guard, the DHHR, the local health departments, our hospital systems, healthcare workers, pharmacies, many, many, many people, that this pandemic is not over yet. And as we go forward, we will continue to respond as we learn more. For instance, we see information coming from Israel that suggests that a single shot of the Pfizer vaccine has an 85% benefit in reducing severe disease 15 to 30 days after the immunization. So as the governor said, getting even a single dose of vaccine in the arms of our most vulnerable citizens, population, is really, really important. And that makes it even more vital that each person in West Virginia, and particularly our folks over 65 years old, and our folks with other medical conditions, or any of our citizens, really will benefit by signing up in our state registration system, so that when it becomes your turn to be vaccinated, that we can do that efficiently and effectively, because we absolutely know that by doing this, we're saving lives. And we want to save your life, and we want to save the lives of people that you love. But the only way that can happen is that you continue to be quite committed to doing the things that you know reduces transmission, and that you put your name into our registration system so that we can get a vaccine to you as quickly as that becomes available. Thank you very much.
All right, thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good morning. As the governor pointed out, we continue to make strong progress with our vaccine distribution program. Our testing program continues to move along, one of the top in the country. Related to vaccines this week, it has been clearly a challenging week for us with the weather, both nationally and in the state. We do have some number of second doses that will not arrive this week from Operation Warp Speed, so we'll be managing that. We're working with our local partners and managing clinic changes that will occur. Some clinics that would occur today and tomorrow will be pushed off until Sunday and Monday. So we will close this week out on Wednesday with our numbers as opposed to on Sunday. But the movement is still strong and still going well, and we're doing it as the governor's tasked us to do safely and in a safe manner, continuing to move forward. We will see this week also that the doses under the federal pharmacy program to Walgreens will not arrive in the state of West Virginia for this week. They will be pushed to next week, so we'll probably receive double the number of doses. The other thing that we are making progress on is working with our two federally qualified health clinic systems, Shenandoah and Valley, that will hopefully starting next week will be receiving doses, which will be additive to our numbers as well. And we are going to continue to work closely with the Veterans Administration over the next week to see how we can maximize doses for our veterans. I just want to highlight, Governor pointed out, as did Dr. Marsh, great numbers and great movement forward. And again, as they have done, caution that we continue to follow those things, masking and distancing that the governor's laid out to us, that we've been able to reduce restrictions on. But the last thing too is there are a lot of great people behind these numbers, from the local health departments to the National Guard to DHHR to our hospital workers and our medical providers. A lot of people doing a lot of great work. And behind that are their families. So I would ask us, when we have the opportunity going forward, to pay attention to the families of these frontline folks, this small group of West Virginians who have taken care of the broader group of us in West Virginia, and try to do something good for their families. Thank you.
All right, thank you, sir. Secretary Bill Crouch with the West Virginia DHHR and Dr. Ayn Amjad, our state health officer, are both joining us today and are available for questions. We'll now go to questions from members of the media. The first from Mark Curtis with Nexstar Media.
Good morning, Governor and staff and cabinet members, and congratulations on the continuing good numbers. I don't mean to be the voice of negativity here, but there have been other states that have expanded their reopenings and so forth, and these states have also had the variants of COVID arrive. I don't believe we've had any of the variants discovered here yet in West Virginia, but are you concerned, in particular, Dr. Marsh, that we might be opening ourselves up for risk of having another surge or spike, especially if any of these variants gets into West Virginia?
Okay, before you say anything, let me just say this. Mark, we're always concerned, and I truly believe we've got to go on, and I'm going to listen to the experts, and I'm going to absolutely make decisions based on recommendations of the experts, and then I'm going to add my 2 cents on whatever I think is the very best for all of us. But without any question, Mark, we would all be really foolish if we didn't think that there is absolutely always in this a possibility that things could slip back. And if they slip back, we just adjust. That's all there is to it. But we've got to absolutely go forward. But anyway, I'm sorry, Dr. Marsh, you please go.
Thank you, Governor. And I think that you touched on it really well. You know, Mark, the governor has been really clear and incredibly consistent to say our number one priority is to save lives. So we are going to follow very closely the assessment of whether any of the positive tests do represent the variants. And the variants that we're talking about here are really the three variants that have gotten a lot of notoriety from the press, which is the variant from the United Kingdom, the variant from South Africa, and the variant from Brazil. We have not detected any of those three variants in West Virginia. What's really, really important, though, to note, and is somewhat reassuring, is the fact that Israel, which we're watching closely because they are testing some different ways to vaccinate their population, and they're using Pfizer mostly for their vaccination right now, that they have the predominant form of the virus there being the United Kingdom variant, and the vaccine is working very well. As I said, recent data from Israel suggests that even a single dose of the Pfizer vaccine has a substantial 85% protection against severe complications of COVID-19 15 to 30 days after the vaccination. And also we know that mask and physical distancing, which is what the governor talked about, I talked about, General Hoyer talked about, is also very, very effective in reducing the transmission of variant forms of the virus. And that's the reason why we were very committed to making sure that we get as many vaccinations in the arms of our most vulnerable people, but also that we really implore each West Virginian to be very, very diligent about wearing your mask and staying physically distanced and doing those things that you know protect yourself and others.
All right, thank you, Mark. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, first of all, I was wondering if you could go through each one of these new changes and say when they go into effect. When can restaurants expand their capacity? When are we trying to get the K through 12 kids back in classrooms full time? And then second, I think it was 2, maybe 3 weeks ago, I asked, you all, if these were the types of things we were considering, particularly restaurants and crowd gathering size. And you said that, at that point, we weren't thinking about them. So I was hoping you could detail kind of how, your evolution of thought on this has kind of changed. What metrics did we look at? I know the numbers have gotten better, but what exactly did we point to say now is the time? Thank you.
Well, Charles, let me try to answer the back end first, because you're asking really what's going on in my head and everything. I'm watching these numbers. All of us are watching these numbers like a hawk all the time. I mean, night and day. I mean, a gazillion prayers and just really, really watching the numbers. We want our restaurants, our bars, we want us to be as close to back to normal as we can possibly be, but we absolutely know that we've lost a lot of folks. And we watch and we watch. As we've seen over the weeks, and in the beginning, whether it be 2 or 3 weeks ago, we started seeing that our death toll was starting to go down, down, down. And we saw at that point in time that our active cases were really moving down. And there has to be a point in time where you reach that point in time where you say, okay, we've gone out and looked several different times, and now we feel like that the numbers are leading us to where it's safe and it's okay to make a move. And so that's why I said on Wednesday that we were really seriously considering doing what we did. And then today we moved. Now, from the standpoint of when, I think that probably what we are planning for is in the executive orders and everything, it'll be midnight tonight. And so from midnight tonight on, we move forward on our bars and our restaurants and our social gatherings and that stuff. As far as going back to school and everything, that's going to be a decision that really falls with the State Board of Education. All I can really do is recommend. And it is absolutely my belief that we should be in school full-time, period. That's all there is to it. With the caveat of trying to do it in a way that is absolutely smart and healthy and safe and with all the safety that we can bring in. From the standpoint of our kids that are 9 through 12, we all know that they can transmit this thing. All the science tells us they can transmit this thing, significantly different and significantly better than our younger kids. From the standpoint of our younger kids now, all the data shows, especially with all the teachers 50 and above getting their second shots, all the data shows go to school. That's all there is to it. We need to be back in school. We are absolutely killing ourselves and killing our kids to not be in school. It is a crying shame. The void that's happening within all kinds of things, from our special needs kids and to all the stuff from the standpoint of, and God forbid, but kids are getting abused and troubled and having all kinds of issues, plus are failing core classes and everything. Without any question, we got to be in school. We just have to be in school. And so I hope that answers it, Charles, but the Board of Education is going to have to make that call.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking my question. Last week, it was mentioned that some essential workers would be expanded in the 50 and older group to be put in line for vaccine prioritization. I haven't heard anything about that today, and I was wondering if that's been pushed off for later, and if it has, when you think that the expansion for other 50 and over essential workers might take place. And also, what is the target date for getting all 55 counties into the Everbridge system? I know the first couple of weeks ago it was 13 counties. This week, 32 counties. Hope to get 55 next week, but that looks like that may not happen. So can you break that down for me? And when will we basically be working from one single list instead of having all of the local counties which have their own lists operating, and that's causing confusion, and there's some irregularities in how these shots are being administered because they're using different criteria. Thank you.
General, this has got to be you all the way across it. Thank you, Kenny.
Yes, sir, Governor. So, Kenny, we should start, and some essential workers over 50 have already started, to include our teachers. Those will continue to roll out over the next couple of weeks as more vaccines are available. This week, 32 counties used lists from the Everbridge, the state registration system. And we will continue to see that grow. I think maybe because of the weather issues and the changes that occurred, not next week, but I think in the next 2 weeks, we'll see all 55 counties using those lists. Understand that essential workers over the age of 50, that they are important to our initiative, and we will continue to try to get to them as quickly as we can with the doses available. And again, remember, we have to pull a certain number of doses off the top each week to get to the people that go into the nursing homes that we haven't had before, staff, hospital staff, and others. So a lot of work continues to be done.
All right, thank you, Kenny. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. I want to gear this question as a secret to your success type question. And Governor, I don't know if I know of any other state that has relied on the National Guard as much as West Virginia has. And y'all are ranked #1 in the country. And I think that may have a lot to do with it. Military does a lot with attention to detail and efficiency, and they train so there are no weak links. I'd like to know, Governor, if you know of any other state that is leaning on the Guard as much as yours, and maybe have General Hoyer comment on the training aspect of the National Guard as making them ready for this assignment.
Paul, I don't know of any other state, and I really appreciate your kind words, but I do not know of another state that is leaning on our guard like I have here. You know, Paul, I truly mean this. You know, through this, there's so many different things, but if you'll just step back and think, you know, when we had that day of prayer, I'm a real believer in prayer, and I'm not ashamed to tell the whole universe that I'm a Christian through and through. And I know I fail the good Lord, you know, from time to time, probably every day, but I keep trying to do better, and with lots of prayers. And He has blessed our little state, you know, with the third oldest population of any state, and a state that has all kinds of chronic illnesses beyond belief. And here, this little teeny state has become the voice of the nation, has it not? And it really, truly has. But with that, Paul, your first question is just truly just this, is how much has the National Guard really helped? And you can't possibly even begin to have to try to put a number on it. They have been so good, so good, it is off the chart. You know, I just can't describe to you how efficient and all the different things that have been brought to the table. Naturally, they've been led by our great general and now the great generals that we have there now. But absolutely, Paul, you've got to listen to me. In West Virginia, you've got to listen. If you have the opportunity to see a guardsman or a guard lady and you have the opportunity to buy them dinner or whatever like that, or just walk up and tell them just how great they really are and how much you appreciate them, please do so. They have absolutely carried our torch like you can't possibly carry it. In addition to that, you know, we have had great work by all of our first responders and DHHR and all the great health, you know, community clinics and all the county health people and everything. It could go on and on. It's just like General Hoyer just said just a second ago. The great people that are behind these numbers oftentimes, you know, aren't highlighted or aren't in the bright lights. We're all in the bright lights, but I am telling you without any question, you have seen a real miracle. A miracle happen in a state that was portrayed as the poorest, the oldest maybe, or one of the oldest, the one with the most chronic illnesses, and absolutely, we have knocked it out of the park. Almost a perfect game. The only one that can be perfect, in my opinion, is the good Lord. But this is as close to a perfect game as we could have possibly pitched. And absolutely, without any question, you know, I'd have to say the National Guard was on the mound. I may have been there catching with the catcher's mitt, but the National Guard pitched a whale of a game here too. Thank you so much to all of them and all the great players that have made it happen. Again, I cannot possibly be more honored to be your governor, and I can't possibly be more proud of the people, all the people from our coronavirus czar, all the people through every agency, all the first responders, all the health people, all the people that have made it happen. It's been a real honor, and I'm proud of them.
All right, thank you, Paul. Next to Brendan Tierney with WSAZ.
Good morning, Brendan Tierney with WSAZ News Channel 3 here. I have two questions today. First, Governor, have you talking with State Superintendent Clayton Birch or any of the other State Board of Education members leading up to your announcement today? And do you think the State Board of Education will follow through with your goal to reopen all schools K through 8 full time? And also, I was hoping Dr. Marsh could give us a bit of the behind the scenes look on the numbers that you're looking at and why right now's the good time to have all these reopenings of bars, restaurants, increased social gathering limits compared to maybe waiting another week or two until those numbers might be even lower. Thank you.
Well, Brendan, I'll pass to Dr. Marsh in just one second, but I want you to know this, that, you know, I mean, there's not a day that goes by that I or my people are not in contact with the state superintendent. A lot of the board members and the superintendent is in contact with the board members. We are in contact nonstop. I mean, this isn't like, hey guys, what about this idea and everything? I mean, for crying out loud, we're in contact nonstop. And from the standpoint, Clay, on why now with the numbers, I mean, why now is because the numbers tell us this. That's why now. And Clay can answer that and everything in way, way more professional detail than I can. But I am telling you without any question, sure, I'll tell you what we can do. We can just wait another 6 months and we can go and we can batten down the hatches and bubble wrap us, and we'll make it probably our percentage of from the standpoint of making it somewhat safer. Yeah, sure it will. Sure it will. But Brendan, listen, and I know too. You come to work every day. I see you outside a lot of times and everything. You come to work because you are living with this terrible killer. And that's what all of us have to do. We got to live with it. We got to do the very best and the smartest things we can do. And I think without any doubt we've done that. But we got to live with it. We got to live with it till we get through it. Dr. Marsh, I'm sorry.
Thank you, Brendan. Thank you, Governor. I think that the governor has really said what needs to be said. We believe that, as we have done with all other parts of this COVID pandemic response, we view this all as a rapid learning cycle. Nobody knows what the future holds, and we have all been surprised by different things that have happened, and we have all adjusted our thinking as we continue to learn more. We are really in a wonderful position to do these openings right now. We don't have the variant viruses that we've detected. We have really been very, very on top of the vaccinations, thanks to General Hoyer and Joe Peel and our GIADF and all of our responders out there. And as I said before, and as the governor said, we follow this very closely. We talk to each other constantly. And if we find that this is not in all ways or in partial ways is not what we hope it will be, which is to see things open up and continue to do so in a very responsible way, then we will make additional, suggestions, and the governor will make decisions for the state. But I think that this, and the governor has asked all of us to weigh in on these decisions. I think it's the right time for West Virginia to continue to move forward and to try to get back to the privileges that we enjoy, but with lots of very intense watching and with the real need for every West Virginian to follow all of the other parts of our strategies that has helped us get here, because mask wearing and distancing and those things are equally as important for our ability to continue to open as it is vaccinate more people.
All right, thank you, Brendan. Next, we'll go to June Leffler with West Virginia Public Broadcasting.
Hello, panel. So I really need to ask two questions today. First, for General Hoyer. So the county data regarding vaccines is showing us that our elderly population in Kanawha County, almost half of them have gotten the vaccine versus smaller communities where, just not as many of them have gotten the vaccine. Can you tell me, why that is the case right now, why the numbers look that way, and what the state is doing to, to get those numbers kind of closer together to bridge that gap? And then I really need to ask the governor, a month ago, you signed the order regarding schools that, that they are allowed to open up. They should open up. How is this order different? And what is the point of this order when, like you said, it's really on the Board of Education?
Dr. Marsh, go with the first part. Go ahead, sir.
Actually, Governor, I think General Hoyer might be better to address the first part, if that's okay.
Oh, that's fine.
Yes, sir. So yes, so June, so as you look at the numbers, and part of the reason we put the data up there was to be more transparent. The governor pressed us to do that and to show people that we are looking at metrics across those counties. As it relates to Kanawha County, number one, they have a significant higher concentration of nursing homes and assisted living facilities, and they have a larger population overall. In addition to that, we saw that when there were some of our hospitals, particularly in Kanawha County, that had extra doses available based on the doses they were allocated for their workforce, they took those extra doses because of our efforts to make sure we use all doses and pushed them to Kanawha County to get to that over 65 population. So I think that's part of what you see with the change in numbers. People across the state should rest assured that the task force is looking at those numbers and will continue to distribute doses based on the percentage of population over age 65 and those percentage of essential workers over 50 based on the guidance the governor has given us to get to those populations. And the good news is we're seeing a significant change in our death rates, and we're seeing a significant change in our hospitalizations.
And if you could come back to me, and I'll try to take the second part of the question, you know, and that's just this. You know, I sent out the order before to our Department of Ed and to our state superintendent and to our board, and basically said this, that, you know, I was encouraging them to get back into school, and a lot of counties did a blended rate and everything and went very virtual. Well, I truly believe we ought to be in school. That's all there is to it. So with all of that, we went way, way, way beyond the call. We ran and vaccinated all the 50-year-old teachers and service personnel that wanted to be vaccinated, and thank God most all of them took the shot and everything. And then we turned right around and went back and got them all on the second dose. Now, in all of that, we were asked, you know, that really until we got everybody with the second dose, we would basically hold up or give them the ability to go to a blended or a virtual deal and all that kind of stuff. Well, now we've got them with the second dose. And so with all of that, again, what I am urging our state board and our state superintendent to do is to put all of our kids that are grades K through 8th back in school full time. Now, the next thing right behind it is we absolutely want to try to do any and everything we can for our 9 through 12, and I love it, you know, that our map is getting so much better, and we want to absolutely continue to be safe in every way. We've poured money and money and money into our schools to try to make them safer. We have absolutely gone far beyond the call with vaccinating our teachers and our service personnel. And without any question, we ought to be back in school. So that's what I'm doing.
All right, thank you, June. Next to Junaid Dill with the AP.
Yeah, Junaid Dill with the AP. Thanks. I'm wondering, will the state allow people with serious health complications to start getting vaccines? For instance, if you're a teacher required to return and you're under 50 with a health complication, can they expect to get a shot soon, or is there any thought behind that? And also, it appears the state got 24,000 first doses this week. Is that correct? And is that due to weather delays? Thanks.
General Hoyer, sir.
Yeah, so when the issue went out to collect the teachers over 50, there was also some notice from the State Board of Education to the county boards to also look for teachers who had been given special accommodations because of health issues. So some of those teachers were already looked at in in those numbers. As it relates to the total numbers, Nate, I can get you that breakdown, but as I mentioned earlier, we are seeing some less doses this week from Operation Warp Speed, but I don't have those exact numbers in front of me right now, but I'll pass those numbers through our public affairs folks to you. But as mentioned, for example, the Walgreens doses coming in the federal pharmacy program did not arrive this week. They will come Monday, and there are some second shots that did not arrive from Moderna this week.
All right, thank you. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everybody. Just wondering, will parents of K-8 children have the option to opt out of the mandatory in-classroom learning if they believe conditions in their children's schools are unsafe?
If that's the end of the question, Phil, absolutely, I believe, and maybe, Secretary Crouch or somebody could weigh in on this, but without any question, that they've had the right and continue to have the right, as far as parents, if they opt out and they want to go 100% virtual and everything, we're providing that, and without any question, they have the right to do that.
All right, well, thank you, Phil. Governor, I'll turn it back to you.
Well, I want to say one thing to the Fort Gay people, that are suffering through some real issues as far as water and sewer down there right now, that we do have our emergency management people that are on the way, as well as the National Guard. We have fought through some really tough conditions and getting, trees out of the roads and snow and all the issues and everything, but I know that you're seeing those people, and from the standpoint of, people running to the fire, I didn't know you had these pictures, but I'm seeing them come up there and everything. Great work by, all the people that are pulling all that off and everything. But to the people, of Fort Gay and all those counties that we declared a state of emergency in and everything, we did it just because of what we're looking at there and everything. These storms have been pretty daggum tough, and thank God, our people are on it, and they're on top of it, and they're on top of it immediately and everything. I mean, you watch the nightly news and you see people that are, again, dying, in numbers, in significant numbers and everything in our southern states because they weren't prepared, or to tell you the honest truth, they depended on a windmill, did they not? And really and truly now the power's out and it just can't work because the windmills are froze up. And they're absolutely sitting there throwing rocks at fossil fuels and say, by God, we shouldn't be using fossil fuels. I mean, that really makes a lot of sense, doesn't it? And really and truly, we I've said over and over, we embrace all the alternatives. Yeah, sure we do. We embrace all the alternatives and everything, but anybody in this country today that believes that we can do without fossil fuels today, I hate to say this because this sounds terrible, but they are so out in left field that they don't even know how to go home. Really and truly, we have got to have our fossil fuels now, and absolutely those poor people are suffering, and they're suffering big time because we've depended on something that's just not reliable. And so with all that, while we subsidize wind and solar and pour money in it to make it look like it's price competitive and everything, when it really boils down to it, that old wonderful, nasty, and some people call it and everything, but I embrace it with love beyond belief, a ton of coal, or absolutely the wonderful work that our gas people are doing, or the wonderful work that our oil people are doing. For crying out loud, we can't do without them right now. And blowing our legs off and everything to just try to look noble, boy, that's really smart. No, I don't think that's very smart. Thank you so much. Sorry to get on that little rant about that, but watch the TV and think about those people down there that are freezing to death. Anyway, thank y'all.
The Senate will come to order. All those not having privileges of the floor will please vacate the chamber. Those in the gallery and those in the floor will please rise as we led in prayer by the Senator from Brooke. Please remain standing as after the prayer, as the Senator from Cabell leads us in reciting the Pledge of Allegiance. Senator.
Thank you, Mr. President. I'm not as eloquent as some of the members here, so I took some liberties and borrowed from someone else in their words today. On January 20th, 1953, General Dwight David Eisenhower was sworn in as the 34th President of the United States. And on that day, he became the first American president to write and recite a prayer at his inauguration. And so I made two small changes to the prayer that he had handwritten on the back of a hotel stationery earlier that day, but otherwise have kept it the same. Let us pray. Almighty God, as we stand here at this moment, my associates in the legislative branch of the government, join me in beseeching that thou will make full and complete our dedication to the service of the people in this great state. Give us, we pray, the power to discern clearly right from wrong, and allow all our words and actions to be governed thereby and by the laws of this land. Especially, we pray that our concern shall be for all people, regardless of station, race, or calling. May cooperation be permitted and be the mutual aim of those who, under the concept of our Constitution, hold the differing political beliefs, so that all may work for the good of our beloved state and for thy glory. Amen.
Thank you, Senator from Cabell.
Please join me as we pledge allegiance to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Reading of the Journal.
West Virginia Legislature Senate Journal, February 18th, 2021. The Senate met at 11:01 a.m. Senator Blair, Mr. President, in the chair.
The Senator from Upshur requests unanimous consent that further reading of the Journal be dispensed with and that the Journal be approved. Is there objection? The chair hears none. Further reading of the Journal is dispensed with and the Journal is approved. Introduction of guest. Senior Senator from the 17th.
Thank you, Mr. President. On behalf of the Senate, it is your pleasure and mine to introduce our doc of the day. In the rear of the chamber with us today, we have Dr. Ben Wainblatt. He's a family medicine resident from Marshall down in Huntington, West Virginia. If the Senate would give him a warm welcome.
Senator from Morgan.
Thank you, Mr. President. For the senators, we're delighted to have in the North Gallery former member of this body, former chairman of the Finance Committee of the West Virginia Senate, former Commissioner of Agriculture for the state of West Virginia, Pocahontas County Commissioner, Walt Helmick, and his wife Rita. If they would both stand and the Senate would make them welcome.
Further introductions. Communications from the House.
The Clerk of the House announced the passage by that body of committee substitute for House Bill 2007, provide for occupational licenses or other authorization to practice by recognition for qualified applicants from other states.
The message will be received and the bill will be referred to the Committee of Government Organization and then the Committee on Judiciary. Communications from the Executive.
There are none.
Reports from standing committees.
Your Committee on the Judiciary has had under consideration Senate Bill 7, limiting political activity by public employees, and reports back a committee substitute for same, with the recommendation that the committee substitute do pass. Respectfully submitted, Charles S. Trump IV, Chair.
The report will be received.
Your Committee on Economic Development has had under consideration Senate Bill 42, creating Zombie Property Remediation Act of 2021. and reports back a committee substitute for same, with the recommendation that the committee substitute do pass. Respectfully submitted, Chandler Swope, Chair.
The report will be received.
Your Committee on Health and Human Resources has had under consideration Senate Bill 67 relating to authority of Emergency Medical Services Advisory Council and reports the same back with the recommendation that it do pass. Respectfully submitted, Michael J. Maroney, Chair.
The report will be received.
Your Committee on the Judiciary has had under consideration Senate Bill 79, providing fair mechanism for adjudication of requests for relocation of parent with child, and reports back a committee substitute for same, with the recommendation that the committee substitute do pass. Respectfully submitted, Charles S. Trump IV, Chair.
The report will be received.
Your Committee on Education has had under consideration Senate Bill 89, exempting certain kindergarten and preschool programs offered by private schools from registration requirements, and reports the same back with the recommendation that it do pass. Respectfully submitted, Patricia Puertas Rucker, Chair.
The report will be received.
Your Committee on the Judiciary has had under consideration Senate Bills 182, 183, 184, 185, 186, 187, 188, 189, 190, 191, 192, 193, 194, 195, 196, 197, 198, 199, 200, 201, 202, 203, 204, 205, 206, 207, 208, 209, 210, 211, 212, 213, 214, and 215. Commissioner of Agriculture rule relating to animal disease control, and reports back a committee substitute for same, with the recommendation that the committee substitute do pass. Respectfully submitted, Charles S. Trump IV, Chair.
The report will be received.
Your Committee on Government Organization has had under consideration Senate Bill 270, providing for collection of tax by hotel marketplace facilitators, and reports back a committee substitute for same, with the recommendation that the committee substitute do pass. Respectfully submitted, Mark R. Maynard, Chair.
The report will be received.
Your Committee on Finance has had under consideration committee substitute for Senate Bill 275, relating generally to West Virginia Appellate Reorganization Act of 2021, and reports back a committee substitute for same, with the recommendation that the committee substitute for committee substitute do pass. Respectfully submitted, Eric J. Tarr, Chair.
The report will be received.
Your Committee on the Judiciary has had under consideration Senate Bill 296, relating generally to repealing certain rules, and reports the same back with the recommendation that it do pass. Respectfully submitted, Charles S. Trump IV, Chair.
The report will be received.
Your Committee on Rules has had under consideration Senate Resolution 6, adopting special rule of order relating to proxy voting due to COVID-19 pandemic, and reports the same back with the recommendation that it be adopted. Respectfully submitted, Craig Blair, Chair ex officio.
The report will be received. Reports from select committees.
There are none.
Introductions of bills. Senior Senator from the 17th.
Thank you, Mr. President. I request unanimous consent that Senate Bill 361 through Senate Bill 371 be considered introduced, read by their titles, and referred to the appropriate committees as shown on the chamber automation system.
The Senior Senator from the 17th requests unanimous consent to Senate Bill 361 through Senate Bill 371 be considered introduced, read by their titles, and referred to the appropriate committees as shown on the chamber automation system. Is there objection? The chair hears none. So ordered. Resolutions.
Senate Joint Resolution 8 by Senator Trump, restoring separation of powers amendment.
The resolution will be referred to the Committee on Judiciary and then the Committee on Finance.
Senate Concurrent Resolution 7 by Senator Maynard, naming the Ira Noon Copley and Marie Copley Memorial Bridge.
Under the rules of the Senate, the resolution will lie over 1 day. Motions. Petitions.
There are none.
Senior Senator from the 17th.
Thank you, Mr. President. I request unanimous consent to return to the fourth order of business.
Is there objection? The chair hears none. So order. Reports to standing committees.
Your Committee on Health and Human Resources has had under consideration Senate Bill 372, originating in committee, relating to the practice of medicine and surgery or podiatry, and reports the same back with the recommendation that it do pass. Respectfully submitted, Michael J. Maroney, Chair.
The report will be received. Unfinished business.
Senate Concurrent Resolution 5, urging Congress call Article 5 convention to impose fiscal restraints on federal government.
The resolution will be referred to the Committee on Judiciary.
Senate Concurrent Resolution 6, naming the U.S. Navy Seaman Second Class Wilbur Webb Hahn and John W. Hahn Memorial Bridge.
The resolution will be referred to the Committee on Transportation and Infrastructure.
Senate Resolution 8, recognizing 149th anniversary of Glenville State College.
Senator from Wyoming.
President, I request unanimous consent that the resolution be taken up for immediate consideration, committee reference to be dispensed with, and the resolution be put upon its adoption.
Is there objection? Chair hears none. Clerk will read the resolution.
Senate Resolution 8, recognizing 149th anniversary of Glenville State College.
Question is on adoption of the resolution. Is there discussion? Yes, Senator from Wyoming.
Sorry, I was clerk for a long time in the court. Yes, Mr. President. I attended Glenville State myself. It's 3 of the best years of my life. It is an outstanding center of higher education. It's been around now for 149 years, since 1872. It has thousands upon thousands of teachers and others. It has won national championship games. It is a great place to go to school, and I could not say good enough about Glenville State College. Go Pioneers.
Is there further discussion? Senator from Jefferson.
I just want to say I support this resolution, and I'm very grateful that Glenville hosted the vice chair and myself when we went to visit it recently. I am really so happy with the work that they're doing. They graduate over 1,000 students every single year. And in case you didn't know, 65% of those students 2 years after graduation are staying here in West Virginia. Those are the kind of results we would like to see more of. I urge adoption of the resolution.
Further discussion. Senator from Harrison.
Was that me, Mr. President? Thank you, sir. I stand in support of the gentleman's resolution. I've stood here many times in praise of Glenville State College, but I think it's an opportunity for us to remember what our small colleges do in West Virginia. In 1872, Glenville State College was established as the West Virginia Normal School. Never was quite sure what that meant. But from there, it has progressed into one of the most vibrant economic contributors to Gilmer County and central West Virginia. It's what makes Gilmer County survive. For every dollar, it was reported to us at an interim committee not too long ago, for every dollar the state puts in a small college, it creates $7 in economic activity. That's a heck of a return on our investment. And Glenville State College is no different and contributes no less to Gilmer County. More important, we have to think about what our small colleges do for our children in West Virginia. Most of Glenville State College's students are first-time college applicants in their families. They come from small towns, rural areas, farms, and hollows where they're not comfortable going to a university like West Virginia University with 40,000 people. They wouldn't know how to find the first classroom. But at Glenville State College and other small colleges, they are comfortable. They can find their math class, they can find their teacher, and they feel at home. That's critical to educating our children to be able to become productive citizens. Without Glenville State College, many people would never go to college or receive a degree. We have Rita Helmick here today representing Glenville State College, and the president asked me to recognize what an addition she is to the Glenville State College family. With 1,600 students and forever growing, 46% of which are females. It's a vibrant part of our community, a vibrant part of our economy, and I urge a unanimous vote on this resolution. Thank you, Mr. President.
Is there further discussion? If not, the question before the Senate is the adoption of the resolution. All those in favor will say aye. Aye. Those opposed say no. The ayes appear to have it. The ayes do have it, and I declare the resolution adopted. Bills on third reading.
Engrossed committee substitute for Senate Bill 66, creating voluntary WVU rifle team checkoff program on hunting and fishing licenses.
Senior Senator from the 17th.
Thank you, Mr. President. I request unanimous consent that the bill lie over one day while retaining its place on the calendar.
Is there objection? Chair hears none. So ordered.
Engrossed committee substitute for Senate Bill 272, relating to West Virginia Employment Law, Worker Classification Act. Third reading of the bill.
Question is on passage of the bill. Senator from Morgan.
Thank you, Mr. President. The committee substitute for Senate Bill 272, Worker Classification Act, amends three existing sections of code. One is in Chapter 21, Article 5. That's our State Wage Payment and Collection Act. One is in Chapter 21A, Article 1A, Section 16. That's unemployment compensation. And one is in Chapter 23, Article 2. That's the State Workers' Compensation Act. And then the gravamen of the bill creates a new article in our state code. It goes in Chapter 21. It's designated as Article 5I. And the new article has 6 sections in it. I'll go through them in just a moment. But the idea behind the bill, the purpose of the bill, Mr. President, is to create a uniform, unitary, single test for determination of whether a person is an employee or an independent contractor in the context of workers' compensation, unemployment compensation, the West Virginia Human Rights Act, the West Virginia Wage Payment and Collection Act. So the new article has 6 sections numbered 1 through 6. And Section 1 is the short title, would be known as the West Virginia Employment Law Worker Classification Act. And in Section 2 of the Act, we have legislative findings that are spelled out. I won't read them all, but the principle, the main principle behind the bill is expressed in the findings, and it is this. It is so that there can be certainty and clarity on this question of whether a person is an employee or an independent contractor that applies uniformly within these chapters of the West Virginia Code. Again, unemployment, workers' comp, Human Rights Act, Wage Payment and Collection Act. And there are other findings in Section 2. Section 3 makes it clear that the test for determination of that question in this article, the new article, supersedes whatever tests existed under the other articles or chapters and what may have existed from case law. Okay, and then the guts of the bill is expressed in Section 4, and basically that sets forth the test. So I'll say just generally about how this is going to work going forward is that the default rule is that people are employees. Under this new law, it says that people will be employees unless they meet the test to be classified or determined to be an independent contractor. And so the test has multiple parts that would be applied now if this is adopted and enacted into law uniformly across workers' comp, unemployment, Wage Payment Collection Act, et cetera. The first part of the test, Mr. President, is in section 4A1, and a person signs a written contract with his principal, his or her principal, in substantial compliance with the terms of the subsection, and states that it's the principal's intent and the worker's intent to engage the services of this person as an independent contractor. And the written signed contract has to contain acknowledgments that the person understands that he or she is A, providing services for the principal as an independent contractor, B, not going to be treated as an employee, C, not going to be provided by the principal with workers' compensation or unemployment compensation benefits. 4, D, obligated to pay all of his own federal and state income taxes on money or earnings that he or she receives arising out of the contractual relationship. E, responsible for the majority of supplies and other variable expenses that he or she incurs in performing the contracted services. And there's an exception to that. So that is part one of the test. You have to have a written agreement signed by the parties, signed by the worker, saying, I acknowledge, I understand, I'm not an employee. I'm not your employee, I'm an independent contractor. I'm paying my own taxes. If I want workers' comp, I'm going to subscribe for it myself. I'm not covered by you. Same with the rest of that. Clear indication of what the nature of the relationship is. That's part one of the test. 2, the second part of the test is this. The worker, the person, is either filed or required to file with regard to earnings his own income tax returns with federal, state, local agencies for the business from the earnings from self-employment, or B, provides his or her services through a business entity, including but not limited to a partnership or a limited liability company, or through a proprietorship registered with a doing business as name. That's the second part of the test. 3, the third part of the test is with respect to the exercise of control over the services provided. And there's some exceptions or carve-outs, but the person, the worker, controls. Actually, the language is on page 30, 31, lines 30, 31 of the bill, 32. The person actually and directly controls the manner and means by which the work is to be accomplished, even though the principal may have final control or control over the final result of the work. But that's indicia that a person is not an employee, but is an independent contractor. That person controls the manner in which the work is performed. And then the fourth part of the test is that the person has to satisfy 3 or more of the following criteria. And they're in the bill, pages 6 and 7 of the committee substitute, A through I, the letter I. And I won't read them all. I'll spare the members that. I'm sure the members have all read all of these. But you have to meet at least 3 of those. So you have to meet all 4 parts of the test to be classified as an independent contractor. So, Mr. President, importantly in this legislation, it's not enough to have a piece of paper that says, I'm an independent contractor. You still have to meet all the other parts of this test, including 3 out of the final 4, which are such things as D, the person is free to exercise independent initiative in soliciting others to purchase his or her services. So that would indicate I'm an independent contractor. I'm not working exclusively for you. I can solicit other people to hire me for what I do, the services that I provide. E, the person is free to hire his own employees or to contract with assistants, helpers, or substitutes. That also, I think we would all agree, is indicia that a person is not an employee if he's free to hire other people in providing the service that he's contracted to provide to the principal. If the person has been subject to an employment audit, if the principal has been subject to an employment audit by the Internal Revenue Service, and if the IRS has not reclassified the person to be an employee, then that's indicia that he or she is not an employee. So the person is responsible for maintaining and bearing the costs of any required business licenses, insurance, certifications, or permits. So, Mr. President, that's the test. Again, I'll go back to where I started. The default is employee. A person's going to be presumed to be an employee unless he or she meets all the elements of this four-part test, including, a written contract that says, I'm not an employee, I'm an independent contractor. And so that's in subsection B of section 4. It says that workers who do not satisfy the criteria above are classified as employees concerning workers' comp, unemployment, et cetera, et cetera. Section 5 of the bill makes it clear that what the legislature is doing here is limiting this to those specific areas. Workers' comp, unemployment, Human Rights Act violations, Wage Payment Collection Act. And it makes it clear that it's not to be applied by courts in determining whether a person is an independent contractor in such things as, or whether the law of principles and agents apply in such things as tort liability questions where a third party is involved. And then section 6 is simply a severability question. Mr. President, this is very similar to a bill, I don't remember the bill number, that we passed last year in the Senate and the House did not. It's substantially similar to last year's bill, but the bill will provide certainty where there is uncertainty now. The bill will provide uniformity where there are disparate and different treatments of testing whether a person is an independent contractor or an employee, depending upon which chapter of our state code we're dealing with. We have different tests now, Mr. President, unbelievably. So, having said all that, I would be happy to try to answer any questions members may have, senators may have about the bill, and urge its passage. I would like to reserve the right to close debate.
Question is on passage of the bill. Is there discussion? Senator from Harrison.
Thank you, Mr. Chairman. I know everybody would be disappointed if I didn't stand up on this one. I want to get out of practice here. With all due respect to my friend from Morgan, this bill is going to do the opposite. It's going to create confusion amongst West Virginia employers, and it's going to have a devastating effect. Let me explain why. You got to ask yourself what the goal of this bill is. Is it to improve our business climate? Is it to make it better for people who want to work in West Virginia? Because it accomplishes neither. What this bill does is sets us back 90 years to the yellow contract days when coal miners used to get paid by the ton, by how many rocks they could chip out of the wall. And they got paid with scrip that could only be spent at the company store. There will be no longer protection for folks that sign this contract for minimum wage, unemployment, workers' comp. If you're a female, it loosens the laws so severely for discrimination and sexual harassment that you'll be unprotected. And every employer is going to say, you want the job, You sign the piece of paper. And what's your choice going to be if you need the job? You'll have none. Choice will be to sign and be an independent contractor. I've seen it dozens of times in my career. Or you'll be looking out on the street for a job that you don't want, if you can get one. So what are the benefits? If you get an employee to sign the paper, you're not going to have to pay unemployment. You're not going to have to pay workers' comp. You're not going to have to deal with the Department of Labor because the labor laws no longer cover this employee, independent contractor. And the Human Rights Act no longer applies, which controls discrimination against race, creed, color, national origin, gender. They're out. It's controlled by a piece of paper, contract. Now, anybody can see that that's bad for an employee. And this is a universal fight. There are all kinds of agencies that promulgate criteria to decide whether you have an employee or an employer. And they're all consistent. They're all generally the same. IRS, U.S. Department of Labor. They're all really consistent. And by the way, folks, we had these arguments for a couple hours in judiciary, fell on deaf ears. I hope I can find some folks listening this time. Because my chairman's always really ready for my arguments, and he did a good job explaining the bill from the other perspective. But what everybody's ignoring here is what it's going to do to West Virginia small businesses. The big companies know not to play this game. But small businesses who can save workers' comp or unemployment, a few dollars more in their pocket, it'll be worthwhile for them to give this a shot. They may even go as far as to believe that this covers federal law, but it doesn't. It doesn't have one thing to do with what the Internal Revenue Service says. It doesn't have one thing to do with what the Department of Labor says about whether you have an employee or an independent contractor. So you sign this paper. You get your employees to sign this paper because you think it meets all the criteria, and maybe it does, maybe it doesn't. And some of those criteria that the gentleman from Morgan laid out are the IRS criteria. But if the IRS comes in and determines 2 or 3 years down the road that you don't have independent contractors working for you, you got employees, you're going to get hit with a bill for all the withholdings, for federal withholding taxes. You're going to get hit with a bill for the Social Security and Medicare matching. And you're going to be personally liable because these are called trust fund taxes. You're collecting them on behalf of the federal government, and you can't discharge that in bankruptcy. You can't claim limited liability of an LLC or a corporation. You owe them personally, and you'll have a choice. And you may not have the choice, but you might have the choice of paying them back and not going to jail. But if you can't pay them back, chances are you may go to jail. Now, I'm sure the rebuttal will be, well, they got to match those, they got to meet those 11 criteria. Well, who's going to enforce that? Who's going to make sure our small businesses are smart enough to make sure that they meet those 9 or whatever it is, all the different characteristics you got to abide by underneath that one section? Who's going to make sure that our employers understand those and are really meeting those? Because if they don't meet them, they're going to have a visit from the Internal Revenue Service. They're going to have a visit from the U.S. Department of Labor. And that's going to be devastating for West Virginia small businesses. Now, maybe I'm parading the horribles. Maybe all of our employers are really smart and they're going to be able to read those criteria and make sure that that these independent contractors really match it. But people have a hard time doing it now for the feds. A lot of people get caught up. I mean, some of us probably know, I know dozens of them, employers that have gotten hit with failing to withhold because they claim somebody was an independent contractor. I'm sure my friend from Ohio County here has prosecuted a few of those cases in his career where people failed to withhold the proper federal taxes for Social Security, Medicare, and income taxes. So, we've created confusion. Get that paper signed. You think you comply with the criteria that are in the bill, which no one will read. You get to save the unemployment and workers' comp. You don't match Social Security, you don't handle withholdings. It's on the employee. It's on the independent contractor. But if they don't pay them, and you're wrong, they're coming out of the employer's pocket. It's not good for employees. It's not going to be good for businesses if they don't do what's right under the Internal Revenue Service Code and the U.S. Department of Labor. But now let's think about the state real quick. Less unemployment premiums, less workers' comp premiums, less people in the pool. We understand how insurance works, which is what unemployment and workers' comp is. Less people to spread the risk around, less premiums to pay claims. This bill's a recipe for disaster. It really is. It's moving our state in reverse by 80 years. It's a recipe for disaster for our employees, for our employers, and even the state of West Virginia. Mr. President, I urge a no vote.
Is there further discussion? Senator from Brooke.
Thank you, Mr. President. I was hoping that today we'd be able to keep the debate to the facts and to what's in the legislation before us. But unfortunately, that's not the case, Mr. President. The senator from Harrison got up and talked about how it's going to be easier for, if you're a woman, we're going to discriminate against you. Sexual harassment, it's tough to prove now under this bill. We're going to talk about yellow contracts and script from coal companies 80, 90 years ago, none of which has anything to do with this bill. Now, I'm sure the senator from Harrison's speech talking about those things and putting fear into women feeling that they're going to be discriminated against should this bill become law, or sexual harassment will become easier in the workplace, will be on social media, but what won't be on social media will be the follow-up. That what he's referencing is the Human Rights Commission and the laws of this state, Mr. President, that prohibit discriminating against people for their sex, race, color, nationality. Nowhere in that act, in the Human Rights Act, Mr. President, doesn't say they can't discriminate against an employee based on those characteristics. Nowhere in that act does it say they can't discriminate against an independent contractor because of those characteristics. The act says you can't discriminate against an individual. It doesn't make a difference if you're an employer, an employee, an independent contractor. It's that you're an individual. 511.9, state code, look it up. Individual. So we can try to gin up some fear over this piece of legislation and talk about script and women being discriminated against and sexual harassment being commonplace if this bill were to become law. But the fact is, Mr. President, if we look at the facts, it's not true. We're talking about individuals in the Human Rights Act, not employees, not independent contractors. Another thing the senator from Harrison brought up is that it will be devastating to the state of West Virginia because of unemployment taxes and the decrease that those will be paid to the state. Well, something I've been trying to find in this bill, Mr. President, from the time it was in the Judiciary Committee to now, is anywhere that it says we're forcing people to become independent contractors. You know, there are tests that exist now in the state of West Virginia on whether someone is an employee or an independent contractor. None of those tests force someone to become an independent contractor. Nothing in this piece of legislation forces someone to become an independent contractor. It clarifies the test and the process by which someone could be one should they choose to be one with their employer. Something else that the senator from Harrison brought up is we're going to make sure our small businesses are smart enough. Who's going to make sure our small businesses are smart enough? Mr. President, I have more faith in our small business owners. It takes a lot to open a small business. The planning, the financing, having the vision, the motivation to do so. I don't own a small business because it's not my wheelhouse, but I know a lot of people who do. And they're all smart enough to know what the laws of the state of West Virginia are. And if they chose to enter into a written agreement with someone on whether or not that person was an employer or an employee or an independent contractor, that's a decision that they made. And if it comes back and there's litigation over it, well, to me, Mr. President, this legislation makes it a little easier. Because if someone who was an employee or an independent contractor and it's now in dispute, one of the things that the small business can point to is you signed a sheet of paper and a contract that we entered into that you were either an employee or an independent contractor. So I don't see this bill as being something that's going to be devastating to small businesses because A, I think they're smart enough to know the laws of the state and how to follow them or how not to follow them. I think they would choose to follow them. And B, should litigation arise or a claim arise over someone who thought that they were one thing or is now claiming that they were another, that small business or the individual, should the claim come from the other side, now has a contract, a document that they entered into and executed with their signature, stating that they were one or the other. So, Mr. President, this bill isn't all that it's being made out to be. It's clarifying the process by which someone could be called an employee or an independent contractor. It provides clarity to our small business owners. It provides clarity to those West Virginians who want to be deemed one or the other. So I think that we just need to stick to the facts of what's in the legislation before us. Thank you, Mr. President.
Is there further discussion? Junior Senator from the 8th.
Thank you, Mr. President. You know, I was kind of taken aback by the statements just now. The statements made by the senator from Harrison are based upon the testimony at committee. The testimony at committee from one witness, a person by the name of Walt Alville, who does more employment law than anybody else in this room, and the entire room combined, says it would create mass litigation and liability on top of the small businesses. These bills that we consider, we just don't look at what it says and what it says fact for fact. We also are required to expect and consider what the impact will be. And I think the senator from Harrison made it very clear, based upon the testimony of not only Mr. Alville, but of the testimony of the attorney who presented it at committee, a couple things. One, it would create litigation and liability for small employers because now there are two tests, the federal test and now this test, that are at odds at each other in some respects. Two, that there are no restrictions on independent contractors now if they decide to go that way. So if you want to be Uber or Mary Kay, you can do that. Today, this bill doesn't make that any easier or clearer. And then three, the very real impact of having a contract we live in a time where unemployment is high in this state for a number of different reasons. People are looking for jobs and are willing to sign away or sign off of, not having money put in unemployment, not having money put in workers' comp in order for them to work. And so that is a very real impact of this bill. And I think that's what the senator from Harrison was trying to say. That's why I oppose this bill, and I urge that the Senate oppose it as well. Thank you.
As a reminder, to put your remarks addressed to the president, please. Further discussion? Senator from Greenbrier.
Thank you, Mr. President. 4 lawyers have spoken to this bill, and they're all a lot smarter than me, and this is probably not a good decision to stand up and speak on this bill today. I'm just a simple country preacher. But I think this bill may apply to me. I'm not sure. I don't understand. So I wonder, would the senator from Harrison yield for a couple questions?
Senator from Harrison yields. Senator yields.
Thank you, Mr. President. Thank you, sir, for yielding. I wanted to ask you to, because you're a lawyer, you're an accountant, you understand this much better than I do. I'm trying to understand who would be considered an independent contractor if this law were to pass. So as I understand it, you have to meet a couple tests, which Senator from Oregon talked about. You've got to sign a contract. You've got to meet several of the following conditions. You can't be required to perform additional services without a new contract. You're responsible for bearing the cost of any required licenses, insurance, certifications, permits. You have to have a license. You're free to exercise your independent initiative to solicit others for some sort of business. Am I on the right track so far about what the conditions are?
It's certainly what the statute says, yes.
Okay. So if you could help me take this to the next level in terms of who this would apply to. Could it apply to a nurse?
Say it again, sir.
To a nurse?
What is he saying?
Nurse.
Oh, absolutely. Absolutely. Could apply to. It's going to apply to anybody that signs that piece of paper. And that's the concern. I believe we tried to get an amendment that said nobody could, no employer could force or discriminate against an applicant for a job based on whether or not they'd signed the paper, and that was refused, and if I remember correctly. But the key here is that once you sign that piece of paper, whether you meet all those criteria or not will be up to somebody who's going to try to enforce that. The employee's not going to, you're the independent contractor after they sign that paper, they're going to be an independent contractor and treated like an independent contractor. There's no enforcement of those criteria until the IRS comes in or until the U.S. Department of Labor comes in and audits you.
Okay. Yeah, see,
but you'll still be an independent contractor.
Okay. Yeah, you mentioned that before, and I wanted to ask you about that because again, this is out of my wheelhouse. If I'm a small business owner, I heard you say before that you think this could negatively impact small businesses, and my understanding of what you said was because there would be a difference between state law and federal law in this area. Is that right?
Yes.
Okay, so what's the difference, and then what could the impact on small business be as a result?
The difference is the IRS will enforce all the 20, I believe it's 24 or 27 criteria that they apply to determine whether someone is an employee or an independent contractor. Everybody wants to treat their employees as independent contractors. They save money. You don't have to handle any of the payroll withholding, you just hand them a check. You don't have to comply with minimum wage because it's a contract. You don't have to match Social Security and Medicare. Biggest part of any payroll besides the wages themselves, it's 7.65% of the gross payroll. I think that's the correct percentage. So it's a money saver. There's going to be an incentive to have independent contractors, just like there was in the 1930s when all coal miners were independent contractors instead of the employees that they were. There's going to be an incentive for businesses to try to come up with a way to make all employees independent contractors to save a little bit of money and put it in their pocket, which is understandable. It's a natural incentive. We're giving them the opportunity here. But when the feds come in, they're not going to care about that piece of paper that was signed that says you're an independent contractor. I think it is one of the 27 criteria, but they're going to look to see if the independent contractor is truly independent, if they truly have an independent business that serves other customers, if they truly control their own work product, if they truly provide their own tools, if they truly have their own financial incentive to do the job. They look at it seriously, not just because somebody signed a piece of paper. Let me give you an example. Your newspaper carrier out there, they sell them the papers to say that they're actually selling a product themselves, and they make them sign an independent contractor agreement. That would not hold up in a court of law, and that will not hold up in front of the IRS.
Okay, thank you. My last question. So, yeah, I was trying to understand how it affects the employer, but now I'm also trying to understand how it affects and you've spoken to this, but I want to make sure I understand correctly, the employee, or in this case, the independent contractor. So if you are the nurse or the paramedic or, whomever this applies to moving forward, what could you potentially lose?
What do you think, as the employer you lose or the employee?
No, if I'm the independent contractor, the nurse or the paramedic or whoever this applies to, and I'm an independent contractor, whereas I was an employee, what would I lose?
Well, number one, you lose the benefits that every employee gets, which is workers' comp, unemployment, matching Social Security, and Medicare. Those are basic. You also lose the ability to have the protection of the Human Rights Act, which we talked about a little bit. And you also lose the protection of the West Virginia Department of Labor, which makes sure if they don't pay you, you can enforce it against them directly to make them pay you what they owe you. It's now a civil matter under the contract. You're also limited to the damages in the contract. Under tort law, under common law, which everybody knows is the law before the courts, you cannot get damages beyond the contract if you're covered by a contract. So if that contract's valid, the employee loses any additional damages other than what's required by the contract. In other words, the pay they lost, or whatever fees they lost under the contract. There's also a lot to be lost here by the employers that they're not going to realize. If you have an independent contractor not covered by workers' comp and that contractor's injured on the job, you're susceptible to a lawsuit for negligence. You're not now in West Virginia under workers' comp because the exchange for no-fault workers' comp, in other words, we'll cover your medical bills if you're injured on the job, is you can't sue your employer except in very rare circumstances. I think that'll be lost, and I think the folks on the committee agreed with that conclusion.
Okay, thank you, Senator.
Thank you.
For helping me understand. Thank you, Mr. President, for the time.
Is there further discussion before the senator from Morgan closes? Seeing none, Senator from Morgan.
Thank you, Mr. President. Let me see if I can begin by clarifying a few things that I think have been incorrectly stated about this bill and what it will do, what it won't do. First of all, I'll concede the point. It is true, it is absolutely true that the IRS applies its own test to determine whether a person is an employee or an independent contractor. It's a 20-factor balancing test, and nothing that this state does can change that, will alter that. The IRS will render its own judgment in those cases as to whether or not, for purposes of withholding taxes, Social Security, that sort of thing, a person is an employee or an independent contractor. This bill doesn't change that. This bill won't, if it passes into law, it doesn't attempt to alter that. We don't apply, Mr. President, in West Virginia now, the IRS 20-factor test in any of these areas. We have tests in workers' comp now, for unemployment now, and they're both different from the IRS test. They're different from each other. Now, what this bill will do is say the tests are no longer going to be different from each other. Now, let's expand it further a little bit. The Fair Labor Standards Act, which is the federal labor law that applies to businesses which employ over a threshold number of workers, has its own test. And that test is different from the IRS test now. It's different from the tests that we employ in state law. So this idea that, we're not going to have the same test as the federal government for the IRS or the Fair Labor Standards Act is just completely wrong. We won't, that's true, but we don't now. We don't have either of those tests now. And we have different tests in all these areas of state law that are administered by or under the auspices of state government. Workers' comp, unemployment, the Wage Payment and Collection Act. What this bill will do is it will say that for all areas where state law controls, unemployment, workers' comp, wage payment collection, we're going to have one test. One test. So it will no longer be possible for a person to be an employee for purposes of unemployment compensation, but an independent contractor for purposes of workers' compensation. That's possible now under our law because the tests are different. And at the risk of sounding like a broken record, I'll say again, all of the tests that exist now under state law are totally different from the IRS balancing 20-factor balancing test, and they're different from the Fair Labor Standards Act tests, which both of which exist under federal law. Now, there are similarities among all of them. That's absolutely true. And if you look at the tests that are set forth in this legislation, you'll see many of the factors that are considered in the IRS test, under the Fair Labor Standards Act test, under
some of the tests that we have in state law now. So it's not as if by passing this legislation we're going to set ourselves apart from IRS any more than we are already apart from IRS. Point number one. Point number two. I guess I'll say it this way. You know, I try to be cognizant of bias when I think about things. We all have our own biases and on certain subjects. And in the opposition to this bill, I hear expressed a bias against employers. Sort of the assumption that employers, businesses in West Virginia are looking to take advantage of their workers. I don't believe that's true. I don't believe that's true, and I don't believe that this bill enables that. And I will say again, this is something that is incorrect that we just heard in the debate regarding this bill. Remember, the Senate said, you sign the piece of paper, that's it. No, that's not true. Signing the piece of paper, the contract, is one part of a multi-part test. So a business and a worker can both sign the piece of paper, but that doesn't end the inquiry. And if it is a sham, if it's really not an independent contractor relationship, as evidenced by the fact that the relationship meets the other elements in the bill of what the test is for an independent contractor relationship, then the piece of paper doesn't matter. That alone does not control the answer to the question. It's one part of a multi-part test. I hear in the debate a bias that's sort of, in opposition to this bill. I would summarize it by saying it sounds as if an argument is people aren't smart enough to figure it out. Employers are biased or destined to take advantage of workers. Employees won't know what's happening to them. They're not smart enough to figure it out. And they need a big nanny state government, to look after them and say, we're going to decide for everybody how it's going to be. Everybody has to be an employee. So California did it, Mr. President, and it was so disastrous that Uber threatened to leave the entire state. They had to change it. I have a bias. Mr. President, we all have biases. I have a bias, and this is my bias. My bias is in favor of freedom. Freedom. And it's really important. We don't talk about it enough, but an important freedom is the freedom to define your own relationships. The freedom for me, if I'm a mortgage broker or a real estate agent or a Mary Kay salesperson or an Uber driver, to say, no, I don't want to be your employee. I want to be an independent contractor. I want to be in business for myself. I'll take care of my own taxes. I don't want you to cover me for workers' comp or unemployment or control every aspect of what I do. I want to be an entrepreneur. I want to be in business for myself. And in the opposition to this bill is a bias against that freedom. And I would suggest, Mr. President, it's a fundamental freedom. Freedom of two people within the bounds of the law to define their own relationship. Freedom of employer to say, I would like to have an independent contractor, or I want to have employees. We heard the argument that, well, of course, every employer wants to have all independent contractors. That's not true. That's not true.
You know, I run a small law office. I don't have any independent contractors who work in my law office. They're all employees. But businesses and people should be respected by us sufficiently that we will recognize that they're worthy of having the freedom to define their own relationships in ways that make sense for them. We'll unshackle with that freedom, unshackle in this state, Mr. President, economic potential that is untapped now. This is a good bill. It is a fair bill. Again, the default rule under the bill is that workers are employees unless they meet all the tests, all the component parts of the bill that allow a person to be considered an independent contractor, including signing a contract and a written statement acknowledging that my status is one of independent contractor. I disagree completely with the argument that there'll be more litigation. I think there'll be less litigation because we'll have on paper, signed by the parties, Mr. President, a business and a worker, a document by what they both signed that indicates what they intend or want their relationship to be classified as. This bill is a bill about freedom, Mr. President, and I urge its passage.
Question is passage of the bill. All those in favor vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? Has every member voted? If so, the clerk will close the machine and ascertain the results. On this question, 21 yeas, 13 nays, and 0 absent and not voting. More than a majority of those present and voting have voted in the affirmative. I declare the bill passed. The clerk will communicate the action of the Senate to the House.
Committee substitute for Senate Bill 277, creating COVID-19 Jobs Protection Act. The bill was advanced to third reading with the right to amend.
Are there amendments to the bill?
Yes, sir. Senator Lindsay moved to amend the bill on page 6, section 4, after line 4, by adding the following proviso, provided that
excuse me. Junior Senator from the 8th.
Mr. President, I ask unanimous consent to explain the amendment in lieu of having it read.
Is there objection? Chair hears none.
Thank you, Mr. President. What this amendment would do, basically, right now, the way the bill, as the bill is constructed, it gives blanket immunity to not only good actors, which are the people we want to protect, but bad actors. And so this amendment would say those who engage in actual malice or reckless indifference would not have the luxury of immunity. Basically, it takes a section or an exception under products liability and applies it to all cases. And let me tell you why I believe this is important. Actually, there's been a recent example. I don't know if you all have been following what's happening in the state of New York, but Governor Cuomo has been accused of sending COVID patients to the nursing home. And according to a watchdog group, that's resulted in about 1,000 deaths. The point of this amendment, let me take a step back. Should this amendment not be made to the bill, Governor Cuomo would get away with it in the state of West Virginia. We should not be in the position to protect bad actors. We should be in the position to protect good actors. So an employer or a business or a hospital that follows the protocols, does the things to protect their employees and their consumers and their invitees, those individuals will be protected by the bill. What this amendment seeks to do is hold those bad actors accountable for their actions. And those actions have to rise a pretty high standard in the law. It has to be reckless indifference or malice, meaning that they intended to hurt someone in their actions. And so I ask the Senate to adopt this amendment. I think it makes a lot of sense. I think it strikes the right tone to protect all West Virginians, and I urge adoption with the reservation of right to close the debate should there be any further debate.
Is there discussion? Senator from Morgan.
Thank you, Mr. President. Respectfully, I rise in opposition to the senator's amendment. I understand that the senator has good intentions in this, but this bill, the fundamental purpose of the bill, Mr. President, is to preempt and prevent gobs and gobs of litigation regarding COVID. Lawsuits that could be directed at any person. You know, it's your fault that I got COVID, or it's your fault that my uncle got COVID. I will concede the senator's amendment does seek to limit by its terms those cases, while allowing some of them, limiting those to more egregious circumstances. But here's my fear, Mr. President, and the reason why I think we should reject the amendment, and that is that it will open the floodgates. You know, the question of, well, was his conduct ordinary negligence or was it gross negligence? Was it just reckless or was it malicious? Every one of those questions is a factual question that's going to have to be answered by juries. And if what we want in West Virginia is hundreds and thousands of lawsuits pouring into our court system over that, people suing one another, suing businesses, employees suing businesses, and co-workers suing co-workers, you know, on the question of, well, you know, you didn't have your mask on properly. Was that negligence? Is it reckless indifference? If what we want is all that litigation for years following the passage of this bill in our court system, then we need not pass the bill. There's no point in passing the bill. I think the bill will open up too wide a door to litigation that will continue and harm the state. So I urge the amendment's rejection.
Is there further discussion before the junior senator from the 8th closes? Junior senator from the 8th.
Yes, Mr. President. In support of the amendment, I just want to point out that right now, without this bill, you know how many lawsuits there are in West Virginia as a consequence of COVID? Zero. So this will not open up the door to gobs and gobs of lawsuits. What this amendment does, is it protects the good actors because it keeps immunity for those folks who do well by their employees and their invitees and their consumers and their patients. But it says, look, if you're not going to take a second to make sure people are protected in your facility, if you are reckless and act with malice, that's not negligence. Reckless and malice are high standards in the law. If you engage in that type of conduct, you will not have immunity. And I think that speaks to the benefits of West Virginia. It protects West Virginia, and I urge adoption of the amendment. Thank you.
Question before the Senate is the adoption of the amendment offered by the junior senator from the 8th. All those in favor will say aye. All those opposed, nay. The noes appear to have it. The noes do have it. I declare the amendment is rejected. Are there further amendments to the bill?
Yes, sir. Senator Lindsay moved to amend the bill on page 8, section 8, line 2, after the word date by striking out the period and adding the words until the COVID-19 state of emergency declared on March 16, 2020 is terminated or rescinded.
Junior senator from the 8th.
Yes, Mr. President. This amendment seeks to...
You request unanimous consent, please.
I know.
You did?
Mr. President, I ask unanimous consent to explain the amendment. Thank you.
Is there objection? Chair hears none. Junior senator from the 8th.
Yes, Mr. President. All this amendment does is seek to put an end date to the emergency declaration and therefore the immunity. It states specifically that once the emergency that's been declared by Governor Justice is rescinded, the immunity no longer applies. This is a common sense amendment to the extent that 7 other states that have adopted COVID liability have adopted some type of end date to bring certainty to the public and bring certainty to our courts. Another practical impact of this is, for right now, the way the bill is written, this immunity would last forever. I'm certain that most people recognize, for example, that the flu pandemic that took out hundreds of thousands of people years ago obviously would not have immunity. We've, as a society, moved past the flu. We've received a vaccination. COVID will be the same situation. We'll receive a vaccination. It will become part of an annual regimen. And so for those reasons, given that and the fact that the immunity will, the actions that this bill seeks to preclude will no longer be an issue, hopefully sooner rather than later, I ask the Senate to adopt this amendment. Thank you.
Then I know to go. Is there discussion? Senator from Oregon.
Thank you, Mr. President. I rise respectfully in opposition to the senator's amendment for this reason. And I get it and I understand that, and maybe even will concede the point, that there may come a time when the protections provided by this bill, if it becomes law, are no longer necessary or warranted. But we do not know now, as we sit here or stand here today, when that date will be. And that's the problem that I have with the amendment. It proposes a termination date that is, or would be, as I understand the amendment, when the governor's declared state of emergency ends. And I don't think that would be the correct or right termination date. We don't know how long this global pandemic will last, but I think we can all say safely that we hope that the governor will, at some point in the not too distant future, be able to end the state of emergency that we've been under. But that will not necessarily be the end of the COVID pandemic, and it will certainly not necessarily be the end of the length of time for which we need the liability protections that are part of this bill to continue. So while I take comfort in the fact, Mr. President, that this body or some future body, some future legislature, Senate or House, will be able to examine this question in future years and decide, let's say the legislature passed in the year 2021 COVID liability protections in Senate Bill 277, and we no longer need them. So a future legislature could repeal them at any time the legislature convenes, which is at least once every year. But as we stand here today, Mr. President, we don't know. We don't have that crystal ball. I wish we did, to know when we're going to be out of the COVID soup, when our economy will have sufficiently and fully recovered. We don't know that. And we can certainly, I think, say that it won't just happen automatically when the governor decides our state of emergency has ended. It may take longer than that. And so we don't have to decide the question today. The question of whether these liability protections of Senate Bill 277 are going to be permanent or should be terminated at some point in the future can be examined, and I'm sure will be examined by future legislatures or by this legislature, perhaps next year, if it's appropriate to examine the question then. So I would urge rejection of the senator's amendment on the ground that there's too much uncertainty. There's too much uncertainty at this point to know today how long the liability protections that we're considering in this bill will be necessary.
Are there others desiring to speak? Recognize the junior senator from the 8th to close debate.
Thank you, Mr. President. The aspect of sunsetting this particular immunity is not novel to our West Virginia law. We sunset rules all the time, every 5 to 6 years, that we promulgate here as a legislature. But I will say this. The most recent data that I've become aware of is A, the governor's loosening restrictions for the economy, B, the vaccinations have gone out pretty rapidly, and as a consequence, the numbers of deaths and the spread have gone down. So we're already assuming that the vaccinations continue as they are at a place where we can know, or it's foreseeable to know, when this disease loosens its hold on our population. So again, it brings certainty to the public and our courts. Otherwise, 3 or 4 years from now, if the legislature does not act on this common sense provision that, again, 7 other legislatures and 7 other states have promulgated, you're going to have a situation where a plaintiff is injured, reasonably injured, there is no COVID, and their case is thrown out because the governor hasn't acted or the legislature hasn't acted. And that's an injustice. So it makes a lot of sense. I urge adoption of the amendment. Thank you.
Question before the Senate is adoption of the amendment by the junior senator from the 8th. All those in favor will say aye. Aye. Those opposed say no. The noes appear to have it. The noes do have it. I declare the amendment rejected. Are there further amendments to the bill?
No, sir.
The bill will be engrossed, and the clerk will read the bill a third time.
Engrossed committee substitute for Senate Bill 277, creating COVID-19 Jobs Protection Act. Third reading of the bill.
Question is on passage of the bill. Senator from Morgan.
Thank you, Mr. President. Committee substitute for Senate Bill 277 would enact a new article in our state code. And it goes, it would be in Chapter 55, Article 19, a new article with 8 sections of code in it, designated as the COVID-19 Jobs Protection Act. First section of the article is a short title, defining the act as the COVID-19 Jobs Protection Act. Section 2 of the bill contains findings, legislative findings, pages worth there, about the novel coronavirus, the havoc it has caused upon our society, that liability protections are necessary to protect businesses and people from litigation related to COVID. Finding 11, the threat of liability poses an obstacle to efforts to reopen and rebuild the West Virginia economy, continue to provide medical care to impacted West Virginians. The Section 3 of the bill, starting on the 3rd page, contains definitions, and it defines terms such as arising from COVID-19. COVID-19 is defined in the bill. It is COVID-19 and coronavirus means the novel coronavirus identified as SARS-CoV-2, the disease caused by the novel coronavirus SARS-CoV-2, or a virus mutating therefrom. There are definitions of COVID-19 care, COVID-19 emergency, first responders, health care, numerous other terms defined in Section 3 of the Act, 16 terms defined. Section 4 is the guts of the Act, Mr. President, claims arising from COVID-19 pandemic. And what it says is, notwithstanding any law to the contrary, except as provided by this article, there is no claim against any person, essential business, business, entity, healthcare, healthcare provider, first responder, or volunteer for loss, damage, physical injury, or death arising from COVID-19. Section 5 relates to products manufactured or sold or donated in response to COVID-19. Section 6 is important. It's workers' compensation protection. It's got language in it that it basically preempts the Mandelitas deliberate intent suits under the Workers' Compensation Act, but does say that workers' compensation benefits are the sole and exclusive remedy for injury or disease or death and from COVID. So to the extent that people can show their COVID was work-related, they acquired it at work, this would make them eligible for workers' compensation benefits. Section 7 relates to severability, and then Section 8 is the application of the statute. It provides for retrospective application, and so it applies retroactively from January 1st of last year, which is, I guess, just a little bit before, Mr. President, and a little before I remember hearing or learning about coronavirus. That it sort of happened, at least onto our radar here as the legislative session last year was progressing, but this would have retroactive application all the way to January 1st of last year. Mr. President, I think this is important legislation to allow the state of West Virginia to move forward, its citizens, its workers, its businesses, without the threat, specter of litigation related to COVID, the coronavirus. And I think it will allow our economy to bounce back faster. I'd like to reserve the right to close debate, but I'm happy to answer any questions senators may have about the legislation. I urge the bill's passage.
Question is on passage of the bill. Is there discussion? Senator from Harrison.
Thank you, Mr. President. I'll be brief. You know, we'll be longer for that, and I see you all go get buddies for that. You know, in all seriousness, I have no bias against this bill. I think the COVID immunity bill is a good bill. We do need to protect our businesses, even though we haven't had a single COVID case filed in this state, not one. I mean, think about that. A year into the pandemic and we haven't had one case filed. What does that tell you? There's not mass litigation out there, but still a good bill. It would have been a great bill that protected workers and employers had we adopted the gentleman from Kanawha's amendment that would have not given immunity to people who acted with actual malice. That means they acted intentionally, with conscious, reckless, and outrageous indifference. Why wouldn't we want that in there? Why would we not want to protect against that kind of conduct? 3 other states, there's been 7 states who've adopted COVID immunity. 3 states require good faith compliance with all of the guidelines that are set forth by their state or local government. We didn't come close to that. But yet we're going to allow intentional conduct to receive the benefit of immunity. You know what that means? It means there's no incentive to protect our workers. There's no incentive to protect our customers. There's no incentive to protect our children. You have immunity. You're free to do whatever you want. That's bad business. That's bad legislation. I'll tell you a quick story. I'm not going to give you any names, but I've received numerous calls like this. Had an office complex where a lot of people work, 2-man office about the size of one of our offices. One of the employees in the office became extremely ill, so ill that they called an ambulance. He had COVID. He was immediately taken into the hospital. The other employee who had worked in the same office with him every day for months and months, including the entire time he had symptoms, was told to keep working, not to isolate himself, and don't go get tested. That's what we've sanctioned. That's what we've given immunity for, and that's wrong. I urge a no vote on this bill as it's written.
Further discussion. Senator from Ohio.
Thank you, Mr. President. I stand in opposition to this bill, but I am generally supportive of a COVID liability bill. I, too, have looked around the country to see what other state legislatures have done, and there are some good bills that have passed that are in place right now. States with Republican-controlled legislatures have, just like us, have passed good bills. The state of Georgia, which is the Republicans control the House, the Senate, the governor's mansion. Don't be distracted by those U.S. Senate races. It's a red state, and they passed a bill that's, I think, really spot on. And they put a standard in their bill in Georgia that says there's immunity, except in cases where there's gross negligence or willful and wanton misconduct, reckless infliction of harm, or intentional infliction of harm. And just the other day, they extended the provisions of that bill to go further into 2021. And so there are really good examples of bills out there around the country by legislatures controlled by Republicans that are in place that provide sufficient protections. We've looked around the country, our council's looked around the country. It appears that this might be the most far-reaching bill if it were to pass and become law. It might be the worst COVID liability bill, depending upon how you look at this, in the country if it becomes law. We've created blanket immunity for everyone. Some of these states have just focused on healthcare workers, which is understandable because they are on the front lines. Our doctors and our nurses and our healthcare folks in the hospital, they're on the front lines. And so some states have just focused on that. Our bill goes beyond that, and it covers all businesses, all entities. We've got blanket immunity here. And so just a few examples just to think about before you place your vote on this bill. If you were to go to the dentist, and maybe some of you haven't been comfortable enough to go back to the dentist, I have. You can't go into the dentist and keep your mask on. They've got to get into your mouth. They've got to clean your teeth. The dentist has to look around and make sure everything's okay. If you were to go to the dentist and your dentist were to be positive for COVID and know that he was positive for COVID, but didn't want to slow down his business, didn't want to stop his revenue from flowing in, Mr. President, and he were to go ahead and put his hands in your mouth and breathe on you and look inside and walk around the office and spread that virus, and you were to get it and be harmed or worse, your family would have no recourse. You would have no recourse in that situation. He'd have immunity. There's a bowling alley in my district right now. I won't name it, obviously, but there's a bowling alley in my district right now where the owner doesn't require the employees or the customers to wear masks. And so I was contacted by a constituent who frequents this bowling alley. He's in a league. He likes to go there. He goes there on a regular basis. It's what he does. He's very uncomfortable going there. He's contacted the health department, as he should have, but the health department in that particular county just hasn't reacted as it should have. The owner of that bowling alley would have complete immunity under this bill if his actions, his reckless actions, were to cause someone to get sick or to die. If there were to be a big New Year's Eve party, let's say, in White Sulphur Springs, and the hotel operator says, the guidelines don't apply to me, and everybody walks around without masks, there's no social distancing, and somebody gets sick, there'd be no liability there either. And why do I say that? You might think, well, what's the big deal about a New Year's Eve party? That was December 31st of 2020. What's the difference? We haven't even passed this bill. Well, as my friend from Morgan said, we are about to get into the liability time machine. We're going to go back in time, and we're going to give immunity to people who have already committed bad acts. We're going to give immunity for behavior that's already been committed, that is reckless, that was indifferent, that was grossly negligent. We're going to go all the way back to January 1st of 2020. So everything bad that happened in that year is protected. Mr. President, I think this bill is well-intentioned. I generally support this type of a bill, but there should be an exception for gross negligence, for the reckless infliction of harm, for the intentional infliction of harm, just as my colleague offered in his amendment. That doesn't exist in this bill. This is a bad bill, and I urge all of you to use your common sense and vote against this bill. Thank you, Mr. President.
Is there further discussion? Junior Senator from the 8th.
Thank you, Mr. President. I'll try to be brief since I've gone over the main points already in the amendments, but as was stated by the senator from Morgan in an earlier debate, most employers, most hospitals, most doctors, most places of business, they do the right thing. They do. They take care of their people. But this bill fails in holding accountable those few bad actors. That means people are going to be harmed because of those bad actors who engage in egregious conduct and reckless indifference and are going to be allowed by this bill to get away with it. That's very real. I support immunity. I support immunity for folks that play by the rules and do right. We all do. Everybody does in this chamber. But this bill gives license for egregious conduct, malice, reckless indifference, and that's what we should not be about. And while I I hoped my amendment would have passed, if my amendments would have passed, I would have tried to become a co-sponsor of this bill, but I cannot support this bill, and I urge that the Senate refuse this legislation. Thank you.
Is there further discussion? Senator from Morgan, Junior Senator from the 17th.
Thank you, Mr. President. I just rise in support of this legislation. You know, the thing about COVID is we watched at the end of the legislative session last year as this thing started to unfold in China and kind of move across the globe or wherever you, but it's been a learning process from day one. And so I know when West Virginia, we saw what was happening in Italy and other countries, and we have populations that's very old and vulnerable. The critical care folks in this state got together. I made calls to Marshall and WVU, and one of the things I was concerned about is there was so much unknown, so much uncertainty when this was happening. I was hearing from colleagues of mine all over the state, especially at smaller hospitals that doesn't have a critical care specialist, doesn't have pulmonologists, and they were saying, what are we going to do? They were panicked. What we try to do is say, you know, what's the best thing we can do today? And so I got on the phone with the intensivist from Marshall and WVU, and we combed over all the research, the recommendations, everything from our societies. And what we tried to do is come up with a standard therapy. So every West Virginian, whether they were at WVU University or they were at a small local hospital, got the same treatment regimen. We made ourselves available to every single physician in this state so that if they had questions, we were on call 24/7 to reach out to them and give them the best info we had at the time, but we were making a judgment call at the time. Now, there's been references here. For example, Governor Cuomo, I'm certainly not a fan of his, but would I be one to condemn him for making a call, sending patients to nursing homes? We don't know the story. There was disasters beyond disasters. I've spoken to colleagues of mine that worked in hospitals in New York while they were at the height of their COVID pandemic, and they were sending people out in body bags like nobody's business. So if he was under guidance that, you know, very stable nursing home patients, get them out to try to keep from the critical ill all through the hospital of maybe containing spread. I mean, those are judgment calls that have to be made on the spot. So it's easy for us to sidearm quarterback and look back and you know, say right and wrong. But the therapies that we decided on in April doesn't even exist now. We don't do any of those. None of us in the medical profession do, because as we learned more as time went on, we found out what worked, we found out what didn't work. Studies started being done and being produced that changed our therapy. So it was an ever-evolving process. So to criticize anybody, I think is faulty. There's been some other examples. I, again, have to believe that there is ultimate goodness in most people. When you talk about the issues I've heard on the floor regarding a dentist or somebody, really, I can't fathom. The reality is, and all of us, I assume, have dentists, that someone understanding the consequence of what a COVID infection means, especially a highly trained professional, is going to take someone's life in their hand by just trying to stay open. And I think that's a weak argument. And when you talk about public spaces, whether it be a bowling alley or what other event, now hopefully people were sensitive enough, smart enough to do the right thing. But if you're seeing that for yourself, I also believe other people have to decide for themselves what's the right thing. So I've said many times through this pandemic, it's not as important what you do, it's important what I do, right? So if I know what's important, stay away from it. That would be my suggestion. If you knew that these people in public spaces, whether it be a restaurant or what other facility, if they weren't taking the precautions and it was making you feel at ease, then don't go. But anyways, there's a lot of ways we can go round and round about this legislation, but at the end of the day, we're still learning quite a bit. I think our small businesses that have absolutely strived to do the right thing, and it's been heartbreaking to see what's happened all across our state. Those that have been fortunate enough to survive, the last thing that you'd want to see is them to get tied up in litigation now after they've tried to do their best by themselves and for the employees that work for them, to then ultimately still be a fatality of the disease, not because of what they did wrong, but because of what they were accused of and ended up in litigation that finished them off. So for those reasons, I stand in favor of the legislation.
Further discussion. Senator from Boone.
Would the majority leader yield, please?
Is the majority leader legal? Majority leader yields.
Senator, again, you talk about people doing the right thing and things like that. Or if they don't do the right thing, you just don't go there and frequent those places. What about the 3 or so senators here that refuse to wear their mask or make a mockery of the masks by wearing a fake mask, something that doesn't function as a mask? Should we refuse to come here?
That's a good question, Senator, but at the end of the day, I think I'll live by my own advice, and you have to make that decision for yourself.
Yeah, thank you.
Further discussion. Senator from Morgan, wish to close the debate?
Briefly, Mr. President, thank you. Committee substitute for Senate Bill 277 is a good bill. It's an important bill for West Virginia right now. And it is unusual. I'll concede that. We are creating liability protections that are very broad and dissimilar to what we have in other areas of the law. But, Mr. President, this is a global pandemic, and it requires extraordinary measures and responses in a lot of different ways. Notwithstanding the fact that people have tried to learn everything they could learn, tried to follow the precautions and protocols that have been issued by our own Clay Marsh, but the United States Center for Disease Control, millions of Americans have contracted the virus. Tens of millions of people worldwide, Mr. President. It is a global pandemic. And we haven't had, it's true, we haven't had mountains of litigation in West Virginia yet, and this bill will preempt it or prevent a lot of that. But just to give the members of this body an idea of what might be coming if we don't do something, let me read to you, if I may, from the USA Today, January 5th of this year. The COVID-19 pandemic spawned more than 1,000 workplace-related lawsuits last year. This is about 2020. And drove a record number of class action cases as employees sued. 2020, the pandemic led employees to file 1,005 workplace lawsuits in federal and state courts, according to the Chicago-based law firm Seyfarth Shaw. Not familiar with that firm. Nearly 200 were related to workplace safety. Workers claimed businesses didn't provide adequate personal protective equipment or hygiene products. Is that what we want to unleash in West Virginia? I think the answer is no. And, you know, I get it that there are members of this body who would feel more comfortable if the bill had in it exceptions for gross negligence or recklessness or even intentional conduct. But let me just say this, Mr. President. Think about it. If I'm a nurse, nurse's aide, I work in a hospital, the big one here in Charleston that has COVID patients, ventilators, people on ventilators. I don't want to go in. I might get COVID. I'm likely to get COVID. My employer says, we have patients. You have to take care of them. We have to take care of them. This is a global pandemic. We don't have the option of saying we're not taking care of people who are in respiratory distress from COVID. We're all going in. We're going in. We're going to take care of them. If I get COVID and become ill, was my employer grossly indifferent? Was my employer reckless? Is what we really need in West Virginia to have juries for the next 3-4 years saddled with lawsuits deciding those questions? No. This bill will preempt and preclude the lawsuits. Here's one from yesterday. This is Bloomberg Press. California, of course, Mr. President. A federal judge is weighing a lawsuit that would hold an employer responsible for a worker's spouse getting sick with COVID-19. Plenty of families have sued businesses, from retailers to meatpacking plants, claiming that they got COVID-19 at their workplace. Corby, I'm not going to pronounce his name correctly, it looks like Kusiemba, and her husband, Robert Kusiemba, are going an extra step by blaming his employer for spreading the illness into his household. This is the first time someone is making the claim that if you have COVID and you live with someone who has a job, you can sue the employer for potentially having given you COVID. Now, you know, you think about what these cases might look like as the trial bar, who I'll credit with levels of creativity I never thought imaginable in some certain circumstances, but push the envelope. We don't need it, Mr. President. It would not be good for West Virginia. This bill is important to allow us to move forward. Let's whip this virus. Let's get our businesses back up and running. Let's get this economy humming and move West Virginia forward without the specter of litigation, not just employees against employers, but citizen against citizen, bowler against the bowling alley. Do we need that? You know, if I make the choice to go bowling, and I know nobody in there is wearing a mask, the law is going to give me a right to sue them because they didn't require everybody to wear a mask. As the majority leader said, at some point, You know, people have to be accountable for what they do themselves, their own actions. And we are in a global pandemic where, despite the most draconian of precautions and measures people have taken, people are still getting COVID. I urge passage of this bill.
Question before the Senate is, shall the bill pass? All those in favor will vote yea. Those opposed will vote nay. The clerk shall prepare the machine. Has every member voted? Has every member voted? If so, the clerk will close the machine and ascertain the results. On this question, 25 yeas, 9 nays, 0 absent, not voting. More than a majority of those present having voted in the affirmative. I declare the bill passed. The senior senator from the 17th.
Thank you, Mr. President. I move the bill be made effective from passage and request unanimous consent that the roll call used on passage of the bill be used to make it so effective.
The senior senator from the 17th moves the bill be made effective from passage and requests unanimous consent that the roll call used on the passage of the bill be used to make it so effective. Is there objection? Chair hears none. On this question, 25 yeas, 9 nays, 0 absent and not voting. More than 2/3 of those elected to the Senate having voted in the affirmative, I declare the bill effective from passage. Clerk will communicate the action of the Senate to the House. Bills on second reading.
Committee substitute for Senate Bill 11, declaring work stoppage or strike by public employees to be unlawful. Second reading of the bill.
Are there amendments to the bill?
No, sir.
The bill will be engrossed and advanced to third reading.
Committee substitute for Senate Bill 12, relating to local health department accountability. Second reading of the bill.
Are there... Senator from Marshall.
Thank you, Mr. President. I request unanimous consent to allow Senate Bill 12 to advance to third read with the right to amend.
Is there objection? Chair hears none. Bill will be advanced.
Senate Bill 69, creating Choose Life special registration plate supporting adoption. Second reading of the bill.
Are there amendments to the bill?
No, sir.
The bill will be engrossed and advanced to third reading.
Committee substitute for Senate Bill 244, making it unlawful for public utility to prohibit customers from hiring contractors to construct, install, or maintain connections to public utilities. Second reading of the bill.
Senior Senator from the 17th.
Thank you, Mr. President. I request unanimous consent that the bill lie over 1 day while retaining its place on the calendar.
Is there objection? Chair hears none. So ordered.
Committee substitute for Senate Bill 280, relating to e-commerce modernization. Second reading of the bill.
Are there amendments to the bill?
No, sir.
The bill will be engrossed and advanced to third reading.
Committee substitute for Senate Bill 293, clarifying that Economic Development Authority is not authorized to enter into banking contracts without state treasurer approval. Second reading of the bill.
Are there amendments to the bill?
No, sir.
The bill will be engrossed and advanced to third reading.
Committee substitute for Senate Bill 295, relating to generally to economic development loans and loan insurance issued by states. Second reading of the bill.
Are there amendments to the bill?
Yes, sir. Senator Maynard moved to amend the bill on page 9, section 11A, line 36, by striking out the word subsection and inserting in lieu thereof.
Senior Senator from the 6th.
Thank you, Mr. President. I request unanimous consent to explain the amendment in lieu of having it read.
Is there objection? The chair hears none. Senior Senator from the 6th.
Thank you, Mr. President. This amendment is technical in nature. It replaces 2 words to clarify the intent of the bill. I will entertain questions. Otherwise, I urge adoption of the amendment.
Is there discussion? If not, the question in the Senate is adoption of the amendment offered by the Senior Senator from the 6th. All those in favor will say aye. All those opposed, no. The ayes appear to have it. The ayes do have it. I declare the amendment adopted. Are there further amendments to the bill?
No, sir.
The bill will be engrossed and advanced to third reading. Bills on first reading. Senior Senator from the 17th.
Thank you, Mr. President. I request unanimous consent that all bills on first reading be considered read by their titles and advanced to second reading.
Is there objection? Chair hears none. So ordered. Introduction of guest. Remarks by members. Senior Senator from the 6th.
Thank you, Mr. President. On your desk, you will see a application for State Automotive Enthusiast Leadership Caucus. On behalf of the Specialty Equipment Market Association, which people call the acronym SEMA, please consider joining this caucus. It is a nonpartisan group of state legislators whose common thread is a love and appreciation for automobiles. The State Automotive Enthusiast Leadership Caucus is more than 600 members strong in 50 states. It's serving to further raise the automotive hobby's profile in the state capitals and in the eyes of the public. From pre-World War II classics to street rods to 60s era muscle cars to late model imports, UTVs, and everything in between, the automobile stands as a source of recreation for hundreds of thousands of enthusiasts and collectors throughout the U.S. By joining the caucus, we will count you among this large gathering. Currently, myself, the senators from Preston, Greenbrier, Monongalia, Lewis, Harrison, Morgan counties, and the junior senator from the 17th are already members of the caucus. And since I placed this on your desks, the senator from Jefferson and the senior senator from the 4th have already submitted their applications. SEMA is a trade association comprised of approximately 7,000, mostly small businesses nationwide, that manufacture, distribute, and retail parts and accessories for motor vehicles. The products manufactured by our member companies include performance, functional, restoration, and styling enhancement equipment for our use on passenger cars, trucks, recreational, and special interest collector vehicles. An important economic engine, SEMA represents an industry with annual consumer sales totaling $39 billion. Our market is the many automotive enthusiasts, your constituents, that modify their vehicles for improved performance, styling, and utility. The industry's livelihood is dependent upon us. Many times we pass bills and laws that directly affect these businesses. One of the advantages to joining this, and there's no charge, is to join them at the SEMA show, and they give you special VIP access. And I attended just as a business owner back in the 2000s, and I marked it off my bucket list. It was something I'd always dreamed of. It's probably the world-renowned car show. And since becoming a legislator, I realized that I have a voice in these bills that affect this industry. I've attended with the senator from Preston, and he can vouch from somebody who automobiles are not their life every day, that it's a great opportunity to see this industry. Delegate Howell in the House is the national chairman of this 600-strong membership of legislators, and he provided me with this application. He's actually taken his new list of applications and FedExing them today after the House floor session. So if you could, I'll sit here at my desk a little bit, and if you're interested in joining, please submit your application. Thank you, Mr. President.
Further remarks. Senator from Preston.
Thank you, Mr. President. Since the senior senator from the 6th called me out on that, I thought I'd better stand up and say a word or two. I have been a member of the State Automotive Enthusiast Leadership Caucus for a number of years now, and I've attended the SEMA conference on 3 different occasions. And the one thing that really impressed me was that I've never attended a conference which had in the vicinity of 100,000 participants in my life. And it was certainly an eye-opening experience, and it made me aware of the opportunities that our state has to expand in those areas and just how much disposable income many people have to soup up their cars. But that being said, it's a great experience, and I would encourage anyone who have the opportunity to please participate. Thank you, Mr. President.
Further remarks? Miscellaneous business. Recognize the senior senator from the 17th.
Thank you, Mr. President. I request that the remarks by the senators from Wyoming, Jefferson, Harrison regarding Senate Resolution 8 earlier today be placed in the appendix of the journal.
Is there objection? Chair hears none, so ordered. Senior Senator from the 17th.
Thank you, Mr. President. Pending announcements, I move the Senate stand adjourned until Monday at 11 a.m.
Are there announcements? Senator from Oregon.
Thank you, Mr. President. Your committee on the judiciary will meet this afternoon at 1:30 p.m. in the Judiciary Committee room in the West Wing.
Further announcements? If not, the question before the Senate is that the Senate stand adjourned until Monday at 11 a.m. All those in favor will say aye. Aye. All those opposed, no. The ayes appear to have it. The ayes do have it. I declare the Senate adjourned.
The House will please be in order. All those persons not having privilege of the floor will please vacate the chamber at this time, and members and guests in the galleries will please rise as we are led in prayer this morning by the gentleman from the 28th Delegate Pack.
Let us pray. Almighty God in heaven, we thank you for the opportunity to meet together in this beautiful building. We thank you for the opportunity to debate ideas and exchange thoughts with one another. Father, we know that we're not always going to agree, but we pray that you would look upon us favorably, that you would help us to communicate with kindness with one another, to show love to our colleagues, and that you would be with us, Father, whether we agree or disagree, Father, that you would look down upon us favorably for the love that we show to one another. Father, through Jesus, we pray these things. Amen.
Amen. If members and guests will please remain standing, we'll be led in the Pledge of Allegiance this morning by the gentleman from the 27th, Delegate Smith.
Please join me in honoring our country and our flag with our pledge. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Members and guests may be seated. Reading the Journal.
Journal of the House of Delegates, Charleston, Thursday, February 18th, 2021.
Gentleman from the 44th, Delegate Hanna.
Thank you, Mr. Speaker. I ask unanimous consent that further reading of the Journal be dispensed with and that it be approved as having been read.
Gentleman from the 44th, Delegate Hanna, asked unanimous consent that further reading of the Journal be dispensed with and it be approved as having been read. Are there objections? There are no objections. Introduction of guests. Reports of standing committees.
Your Committee on Banking and Insurance has had under consideration House Bill 2221 relating to the establishment of an insurance innovation process. Reports the same back with the recommendation that it do pass, that it be referred to the Committee on Judiciary.
Report will be received and the bill will be referred to the Committee on Judiciary.
Your Committee on Veterans Affairs and Homeland Security has had under consideration House Bill 2093 relating to exemptions for the United States Department of Veterans Affairs medical foster homes. Reports the same back with the recommendation that it do pass, that it be referred to the Committee on Health and Human Resources.
The report will be received. The bill will be referred to the Committee on Health and Human Resources.
Your Committee on Veterans Affairs and Homeland Security has had under consideration House Bill 2076 removing all costs and fees from a Silver Star registration plate. Reports the same back with the recommendation that it do pass, that it be referred to the Committee on Finance.
Report will be received. The bill will be referred to the Committee on Finance.
Originating in the Committee on Health and Human Resources is House Bill 2626 relating to discontinuing operation of certain state facilities, reported with the recommendation that it do pass.
The report will be received and the bill will be referred to the Committee on Finance.
Your Committee on Judiciary has had under consideration House Bill 2184 increasing the penalties for exposure of governmental representatives to fentanyl or any other harmful drug. Reports the same back with the recommendation that it do pass.
The report will be received.
Your Committee on Judiciary has had under consideration House Bill 2094 relating to the juvenile restorative justice programs. Reports back a committee substitute, therefore, with the recommendation that the committee substitute do pass.
The report will be received. Are there further reports of standing committees? If not, reports of select committees. Message from the executive. Message from the Senate.
The Clerk of the Senate announced the Senate has passed without amendment committee substitute for House Bill 2358, updating meaning of federal adjusted gross income and certain other terms used in West Virginia Personal Income Tax Act.
The message will be received.
The Senate has passed without amendment House Bill 2359, updating the meaning of federal taxable income and certain other terms used in the West Virginia Corporation Net Income Tax Act.
The message will be received.
The Senate has passed committee substitute for Senate Bill 15, relating generally to infield master's degree.
The message will be received. The bill will be referred to the Committee on Education. Are there further messages from the Senate? If not, resolutions.
House Concurrent Resolution 5 to provide an Article 5 convention in order to propose an amendment to the U.S. Constitution where 3/5 of the states could overturn a federal law.
The resolution will be referred to the Committee on Judiciary, then the Committee on Rules. Petitions, motions, lady from the 49th.
Thank you, Mr. Speaker. I move to reconsider the title amendment adopted yesterday on House Bill 2013.
Questions on the motion to reconsider the title amendment adopted yesterday on House Bill 2013? Those in favor of the motion will please say aye. Aye. Those opposed, please say no. The ayes have it. The chair declares the motion adopted. Lady from the 49th.
Thank you, Mr. Speaker. I ask unanimous consent to withdraw the title.
Are there objections to the title amendment being withdrawn? There are no objections. Lady from the 49th.
Having voted on the prevailing side, I move to reconsider the passage of HB 2013.
Question before the House is a motion by the lady from the 49th that the House reconsider the vote yesterday on passage of House Bill 2013. Is there discussion on the motion? Gentleman to 64th, Douglas Householder is recognized.
Thank you, Mr. Speaker. Ladies and gentlemen, after much consideration of the several issues that were raised yesterday about the eligibility for the Hope Scholarship bill, I do concur with the gentlelady's motion. Now, I have reviewed the fiscal note as prepared by our new Fiscal and Regulatory Affairs Office. And to the members, the fiscal note is now on the West Virginia Legislature's website under bill status for House Bill 2013. Now, my concerns on the eligibility issues are as follows, and this is right out of the fiscal note. It says, based on our interpretation of the eligibility criteria, a parent of a student currently in a private or homeschooling could enroll their child in a summer public school program, making them eligible to apply for the Hope Scholarship program. Alternatively, they could enroll their child in the public school system to become eligible. As this would introduce new students into the eligible population, it has the potential to substantially increase costs. For those reasons, I believe the right thing to do is to address those concerns, and I ask for your consideration in support of the gentlelady's motion.
Are there other members who wish to speak to the motion? If not, the gentleman 32nd, Douglas Fast.
Thank you. Would the majority leader yield?
Yes, sir.
My question is, if this passage vote is rescinded, and that's what you're asking for, correct?
Yes.
What would be the intent of getting the bill back for another vote?
The intent would be to send the bill back to Finance, have them review all the fiscal data so that we can proceed as if fiscally responsible, and then bring that back to the floor. It comes back on second reading. We could advance it to third, take the vote again, and repass the bill.
Thank you.
The question before the House is a motion by the lady from the 49th that the House reconsider the vote on passage of House Bill 2013. Those in favor of the motion will please say aye. Aye. Those opposed, please say no. The ayes have it. Chair declares that motion adopted. Lady from the 49th.
Thank you, Mr. Speaker. I ask unanimous consent to recommit to House Bill 2013 to the Committee on Finance.
Lady from the 49th asks unanimous consent that House Bill 2013 be committed to the Committee on Finance. Is there objection? There are no objections. House Bill 2013 is referred to the Committee on Finance. Are there further motions? Bills introduced.
House Bill 2600, require all public contracts be publicly advertised.
Lady from the 49th.
Mr. Speaker, I ask unanimous consent that the further reading of bills introduced be dispensed with and that each bill be considered as formally introduced and referred to the appropriate committees as indicated on the delegate console system.
The lady from the 49th asks unanimous consent that further reading of bills introduced be dispensed with and that each bill be considered as having been formally introduced and referred to the appropriate committees as shown on the delegate console system. Are there objections? There are no objections. Unfinished business. Bills on third reading.
Committee substitute for House Bill 2003 relating to the authority and obligations of the governor and legislature when in declared states of preparedness and emergency.
Are there objections to having the bill explained in lieu of having it read? There are no objections. The gentleman in the 35th, Delegate Capito, to explain the bill.
Thank you very much, Mr. Speaker, and good morning, everybody. The bill before you garnered some discussion yesterday. I want to walk through the high points of the bill. It's a short bill, but an impactful bill, and I'll be happy to take any questions following that. Committee substitute for House Bill 2003 is what I'd refer to as a good government bill. One of the, I think, the best things and most important things that we can do in this body is to ensure that the structure of our government is balanced and operating appropriately. And the bill before you, as I mentioned yesterday, was part of a working group that worked this past summer in response to the state of preparedness and state of emergency that we've been in for quite some time right now, and to bring greater balance of power to that process within this government. And this bill provides that structural change in a sound and reasonable way. The bill currently, well, let me just step back. In current law, there are no time limits that apply to a declared state of preparedness or a declared state of emergency by the governor. This bill seeks to solve that issue by implementing time limits for the duration of how long a state of emergency or state of preparedness can last before legislative action must be taken. So in the case of a state of preparedness upon declaration can last no longer than 30 days without further review by this body in a concurrent resolution that either extends that state of emergency, or this bill provides the ability for this body to alter the state, expand, or limit the scope of that state of preparedness. Similarly, with regard to a state of emergency, a state of emergency can last no longer than 60 days without review in the same manner by this body. Again, this body can review and by concurrent resolution extend, limit, or halt a state of emergency in the state of West Virginia. It provides some definitional code in there. You'll see in the bill that provides that the governor must provide in a state of emergency or a state of preparedness a greater description for what is being addressed in the state of West Virginia. It does some more technical things, such as it provides mechanisms for challenging the declarations in court. It delineates certain items which must be contained in any declaration, as I mentioned, of preparedness or emergency. And that's a summarization of the bill. Mr. Speaker, I'm happy to take questions.
The question before the House is, shall the bill pass? The gentleman, the first, Douglas McGeehan, is recognized.
Thank you, Mr. Speaker. Will the chairman yield?
Yes.
Do the restrictions on the duration for a declaration of emergency in this bill apply to the current state of emergency if this bill becomes law?
As I said yesterday, that's my belief, yes.
It's your certain belief. Without a doubt, you believe that for certain, on the record.
I believe that.
There was a movement, you might recall, this past summer, and you mentioned that you believe this is a very strong, good bill to correct the balance of power. And there was a movement this past summer to push for a special session to come in here and reflect the concepts enshrined in this law. You were presented with an opportunity to sign on to a letter to call us into session. Did you sign that letter?
Not that I recall.
That's all I got, man.
Thank you.
Are there other members who wish to speak to passage of the bill? If not, the question before the House is the gentleman from the 13th, Douglas Pinson, is recognized.
Yes, sir. Thank you, Mr. Chair. And I'll rise in support of the bill. There has been a working effort over the summer. There's been a working effort for this bill to be crafted. We've heard the bill in judiciary, and after much discussion and debate in judiciary over the bill, we've presented the bill out for the House to consider now. I have answered more telephone calls and emails about this bill than about any single piece of legislation so far, and I'm thankful to be able to stand and to support the bill that's in front of us, to be able to take action on the floor today, that we can set the precedent moving forward, that there should be a balance of power. And I would urge the members to consider that the legislation before us is a statement to that effect, that we are trying to ensure a balance of power, and that's the purpose of the bill before us. Thank you, Mr. Speaker.
The gentleman of third, Doug Fluharty, is recognized.
Thank you, Mr. Speaker. Would Chairman yield?
Yes.
I want to go through some of the questions that were asked earlier by the gentleman from the first, because I have some recollection of Judiciary Committee and what was testified to up there as to whether or not this would, as you described, this impactful legislation, whether it would be impactful towards the current state of affairs that we've had since March 13th, 2020. Now, it's my understanding in committee, testimony from counsel, who is there with you, we discovered that in order for it to apply to the current emergency orders that are in effect, the governor would have to take an overt act in issuing a new declaration. Isn't that true?
No.
Wasn't that was the testimony in committee?
I don't. The counsel doesn't testify. The gentleman from the first, as I recall, asked what my opinion was.
That was your opinion then?
I wasn't asked my opinion at the committee meeting. I was just asked it by the gentleman from the first.
But in committee, we had testimony when we were asking questions of counsel as to whether it applied to the current state of emergency. And after discussion and after we went through it, we decided in committee that it would take an amendment in order for it to apply to the current state of emergency. Isn't that true?
There was an amendment.
Okay, and we passed that amendment?
The committee adopted an amendment.
That's right. And then something happened. I don't know exactly what, but we came back and a motion was made to reconsider that amendment, right?
Generally, things happen when something happens, yes.
And was there any testimony at that time, other than, I guess, your opinion, that it did not apply? Do we have any other further testimony?
There was no testimony.
It was just a motion made by the vice chair at the time to reconsider the amendment without any further testimony?
There was no sworn testimony about this bill in committee.
So,
at any point in time.
Well, there's questions of counsel at the time, and we went through the analysis.
There were questions of counsel.
And after going through the questions of counsel and the analysis, it was the committee's opinion that we needed the amendment in order for it to apply to the current state of emergency. Isn't that true?
I don't think the council, my recollection of it, I would have to go back and listen, was not dispositive in any manner, but I believe that it said he believed it would, but I mean, could be staying corrected.
Okay, thank you. Very briefly, Mr. Speaker.
The gentleman is recognized.
I have great respect for the gentleman from the first. Now, we do not agree on everything, as you can imagine, but I think what we do agree on is that we have an obligation here for the Constitution and the process, and that will survive all of us. We are just mere nameplates right here. We are just mere nameplates while we're down here. This body will survive us. The Constitution will survive us. The process will survive us. And we've known since March of 2020 that we need to make a change. Businesses being shuttered. Email after email for those of us who have been serving during this whole crisis, asking about what's going on, knowing full well that we have the power of the purse. The Constitution beholds us that power. Yet, it has been infringed on by the executive. And we had an opportunity yesterday to apply the amendment, to make clarification, to understand that, yes, we're going to stand up for the process, for the Constitution, for this legislature. And we didn't do that. What we're passing here now is mere symbolism. So we can act like we did something. So we can go back home and say, yeah, we stood up to the executive. We know we're not going to let this happen again. But in reality, I think we all know that once this gets enacted and that time passes and you start wondering why the executive order is still in play, you're going to know maybe we didn't get it right. The legislative intent was clear yesterday that we decided to cower in fear to the executive branch and not stand up for our own powers here in the legislature. Thank you, Mr. Speaker.
The gentleman from the first Douglas of Teslo.
Thank you, Mr. Speaker. Would the chairman of Judiciary yield?
Yes.
Mr. Chairman, I just have a couple questions. Assuming we pass this bill and make it effective from passage, as is, what happens? Does the 60-day period start for emergencies?
Well, assuming that it's adopted and passed, and then it either is signed by the governor, and then it, yeah, I would suggest, my reading is that it probably would trigger almost immediately for the ability for the legislature to be in, because it's already been in effect for over 60 days and 30 days.
Okay, and if the amendment was in there, what would happen?
What amendment?
Would the 60 days trigger in a similar fashion?
Well, that would depend on the interpretation of the amendment, but the amendment's not in this bill.
In any event, quickly, the 60-day period starts.
That's my reading of the bill, yes.
Thank you. Mr. Speaker, just briefly, I'd like to address the bill.
The gentleman is recognized.
Okay, so here we are. We've come together, and I think this is a bipartisan thing, that the legislature has to be involved in analyzing states of emergency and whether they need to go on or not. I think that's pretty well established by everybody, and I think it's a very, very, very good thing to do. What I want to do is make sure that we get this done in as good a manner as possible, and I see no difference, really, very little difference in the bill as is or amended, and I think what we need to do is pass this bill, do our duty, which we will have done, to make sure that the legislature is involved, and they will be involved, and go forward in a spirit of cooperation with all the parties, because emergencies are critical, and their well-establishment and their handling of emergency situations are real important to the state of West Virginia. Cooperation is called for, and this legislature's input is critical, and I think we achieve that, and I support the bill. Thank you.
The gentleman to 16th, Douglas Mance, recognized.
Thank you, Mr. Speaker. You know, yesterday we did have an opportunity, and several of us voted for that opportunity. Our delegate from the 1st put in an amendment, and you know, we are elected by our districts, and that's what's important, and that's a lot of times how we need to vote. We've got to vote according to our districts and those people that put us in a position. And we did that yesterday. Unfortunately, for those of us that did vote for that, it didn't pass. You know, we've got to move forward, and we've got to look at what else is going on. Could the chairman yield just a second? I have one question I'd like to ask for clarification for all of us.
Yes.
Hey, thank you. So let's say we pass this bill today. We do have the opportunity to call ourselves into special session if we choose. Is that correct? After this session, we could call ourselves back in?
I could stand corrected by the chair, but I believe this body, and along with the body across the hall, can call itself in for any reason at any time, regardless of this bill.
Okay, so for some people that are concerned, there is a safeguard there where there is an opportunity to do that if we did have the votes, and the same with the Senate, right?
Gentleman's correct.
Okay, thank you. That's all I had to ask. You know, this is an important bill. I'm in the restaurant business, and fortunately, we're a drive-in business, so you're in your car and you're safe, and you can wear your mask or not wear your mask. But for those people that are in the restaurant business that are being crushed by the mandates that have been put out there and the safeguards that are put out there, and we understand why. It's to keep people safe and to keep restaurants going to some degree. But I think today there was an announcement that 75% capacity now in restaurants. And if numbers don't rise, we'll go to 100% in a couple of weeks. So that's a start. It's a start for a lot of people. And in the Huntington area, we don't have a lot of manufacturing jobs, but we do have a lot of restaurants, as we do all across the state. I just wanted to ask the chairman that question so all of us would understand, and some that are concerned, that we can go back into a special session if we needed to. But you know, I will vote for this bill today, and I hope we can pass it and move forward and be positive and do some things that we need to do here and put out some good legislation. Thank you very much.
The lady in the 51st, Doug Fleshour, is recognized.
Thank you, Mr. Speaker. Would the gentleman, the chair of Judiciary, please rise to respond to a question again?
Yes.
I was just trying to clarify when this takes effect. So do you believe that it applies upon passage?
When it takes effect. When the law takes effect.
Okay. And have you considered, or are we going to have immediate effective date, or are we going to have the normal 90 days?
My understanding was that it might be an immediate take effect from passage. But
Okay.
that needs to be a motion made after this vote.
Okay. So what happens after passage? Will the clock start ticking on the 60 days then, or does it apply because we've gone 10 months after 60 days?
I think once the bill becomes law, so once it takes effect, my reading of it was that these states of preparedness, to the extent any state of preparedness or state of emergency has been in effect longer than 30 or 60 days respectively, they would come under this law.
So we would not have to wait 60 days?
That's my reading.
Oh, okay, because I was a little confused by when you mentioned the 60 days. So your reading is that because the 60 days have already long passed, it would go immediately into effect if both houses make the bill effective from passage.
Well, correct, when the bill goes into effect. I mean, it doesn't go into effect until, yeah. But once it's in effect, it would be effective from...
Immediately?
Yes, correct.
Okay.
The lady's correct.
Okay, I just wanted to clarify that. Thank you very much.
Gentleman, the 35th, Doug Capito, to close debate on the bill. Question before the House is, shall the bill pass? Those in favor of passage will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 97 ayes, 0 nays, and 3 members absent not voting. A majority of members having voted in the affirmative, the chair declares the bill passed. The clerk will please report the title.
Committee substitute for House Bill 2003 relating to the authority and obligations of the governor and legislature when in declared states of preparedness and emergency.
For what purpose does the gentleman from the 3rd, Doug Fluharty, seek recognition?
I move that the bill, House Bill 2003, take effect from passage.
Are there amendments to the title? If not, the title as read by the clerk will be and remain the title of the bill. The gentleman from the 3rd has moved that the bill be made effective from passage. For what purpose does the gentleman from the 1st, Doug McGinn, seek recognition?
Yeah, I ask unanimous consent to put the gentleman from Charleston's comments in the appendix of the journal. The chairman of the Judiciary Committee.
Okay. The gentleman from the 35th, Doug Capito. Are there objections? Chair hears no objections. The motion is, the question before the House is the motion by the gentleman of the 3rd that the bill be made effective from passage. Those in favor of that motion will vote aye. Those a roll call has been, roll call is automatic, but it is sustained. Those in favor of the motion will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 97 ayes, 0 nays, and 3 members absent not voting. 2/3 of members elected having voted in the affirmative, the chair declares the bill effective from passage. For what purpose does the gentleman from the 51st, Douglas Hanson, seek recognition?
Thank you, Mr. Speaker. I seek unanimous consent for the exchange between my colleague from the 51st and the Chair of Judiciary to be entered into the appendix of the journal.
Are there objections? There are no objections. The clerk will please communicate the action of the House to the Senate and request concurrence therein. The gentleman from the 30th, Douglas. Next bill on third reading.
Committee substitute for House Bill 2009 relating to limitations on the use of wages and agency shop fees by employers and labor organizations for political activities.
Are there objections to having the bill explained in lieu of having it read? There are no objections. The gentleman from the 35th, Douglas Capito, to explain the bill.
Thank you very much, Mr. Speaker. Honored to be in the appendix of the journal today. This bill addresses three aspects of our code that are addressed before you here with this bill. The first is 3-8-12, which relates to the regulation and control of elections. In that section of code, this bill seeks to protect an employee's wages or salaries from being withheld or diverted for political activities without the express written authorization of the employee. The bill makes clear that it's unlawful for any person to coerce or intimidate any employee into making a political contribution or engaging in political activities. The second section of code that this affects is 21-1A-4, unfair labor practices. The bill makes it unfair labor practice for any labor organization to use agency shop fees by non-members for contributions for expenditures to influence an election without the authorization of the individual. And the third section is the wage payment and collection section, and the bill proposes to remove union or club dues from the definition of deductions. Mr. Speaker, that's a summarization of the bill. I'm happy to take questions.
The question before the House is, shall the bill pass? Are there members who wish to speak to passage of the bill? If not, those in favor of passage will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 61 ayes, 36 nays, and 3 members absent not voting. A majority having voted in the affirmative, the chair declares the bill passed. The clerk will please report the title.
Committee substitute for House Bill 2009 relating to limitations on the use of wages and agency shop fees by employers and labor organizations for political activities.
Are there amendments to the title? If not, the title is read by the clerk. Will be and remain the title of the bill. The clerk will please communicate the action of the House to the Senate. Next bill on third reading.
Committee substitute for House Bill 2014 relating to role of the legislature in appropriating federal funds.
Are there objections to having the bill explained in lieu of having read? There are no objections. The gentleman to 64th, Douglas Householder, to explain the bill.
Thank you, Mr. Speaker. The committee substitute for House Bill 2014 would amend existing law relating to the disposition of monies received by the state, including the appropriation of federal funds, reductions and expirations of appropriations in the event of revenue shortfalls, and updating of obsolete provisions. I urge passage.
The question before the House is, shall the bill pass? Are there members who wish to speak to passage of the bill? If not, those in favor of passage will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 97 ayes, 0 nays, and 3 members absent not voting. A majority of members having voted in the affirmative, the chair declares the bill passed. Clerk will please report the title.
Committee substitute for House Bill 2014 relating to role of the legislature in appropriating federal funds.
Are there amendments to the title? If not, the title as read by the clerk will be and remain the title of the bill. For what purpose does the gentleman 26, Douglas Evans, seek recognition?
Mr. Speaker, I don't think I was paying attention a minute ago. I voted on 209 and the negative should be in, or in the positive should be in the negative. I'd like to have that changed on 2009.
On House Bill 2009?
Yes.
The gentleman could make a note to have something recorded with the clerk's office.
Thank you.
Lady from the 49th on House Bill 2014.
Thank you, Mr. Speaker. I move it take effect from passage.
The lady from the 49th moves that committee substitute for House Bill 2014 be effective from passage. Those in favor of the motion will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 97 ayes, 0 nays, and 3 members absent not voting. 2/3 of members elected having voted in the affirmative. The chair declares the bill effective for passage. The clerk will please communicate the action of the House to the Senate. Request concurrence therein. Next bill on third reading.
Committee substitute for House Bill 2325, removing the requirement of continuing education for barbers and cosmetologists.
Are there objections to having the bill explained in lieu of having it read? If not, the gentleman of the 29th, Douglas Steele, to explain the bill.
Good morning, Mr. Speaker. Thank you. The purpose of this bill is to restrict the authority of the Board of Barbers and Cosmetologists to regulate the use of commonly available retail beauty products and to remove the requirement of continuing education for barbers and cosmetologists. Thank you, Mr. Speaker. That's the bill, and I urge passage.
Are there members who wish to speak to passage of the bill? If not, yes, the lady from the 51st, Circuit Walker, is recognized.
Thank you, Mr. Chairman. Would the chairman of the committee yield?
Yes. Chairman does yield.
Can you please give me some examples of continuing education for the barbers and cosmetologists?
The only thing that's statutorily written is sanitation, and any other requirements or requirements put on by the board through rules.
Can you tell me how many hours of sanitation must a cosmetologist have and also an instructor?
It is 2 hours per year until that person has 10 years, and then it's every other year.
Can you tell me who wants this bill to stop the continuing of education?
I'm sorry, I didn't quite understand
Can you
what
please
said.
tell me who wants this bill to stop continuing of education?
I still didn't understand what you said.
Can you please tell me who wants this bill to stop the continuation of education to our barbers and cosmetologists in the state of West Virginia?
The people of West Virginia.
So this didn't come from the board. This didn't come from the industry
The
themselves.
board, we got input from the board, and they were totally fine with it.
Can you tell me what
Yes.
Can you please tell me, passing this legislation, what is it going to do to the insurance that these people have with liability?
We got no information that it would have any effect on their insurance.
And do you think that this is going to affect the instructors? Because the instructors' continuing education hours is different than those who work in the industry.
This will, if you talk about the people that run cosmetology schools, I do not believe that this bill would affect them.
So the instructors will still have to do continuing education, but the people who are actually working in the salons and barbershops, we're not going to make them continue their education.
I'm not aware of the continuing education requirements for instructors. If that's different, it may be contained in rule, but it's not part of this code.
Okay, thank you, Mr. Chairman. Can I speak to the bill?
Yes, the lady is recognized.
So I just received a text message from students who are attending and about to graduate from the beauty school in Morgantown, and also the one here in Charleston. And they feel like we're playing with their livelihood because they're going to be entrepreneurs in our state. And we're making their jobs more like a hobby than putting West Virginians first. So continuing education in this particular industry is about sanitation. And I do recall we're in the middle of a pandemic. That continuing education also gives them information about human trafficking, which seems like the majority of the persons in this body really don't care, I guess, until it hits home and close. This happens, believe it or not, in many nail salons. The board may not have had a problem with it, but is it those board members that are actually in those shops? These people have been hurting during this pandemic. And it doesn't mean that they don't have an option that they can't continue the education. But we just keep on disrespecting the workers of this state. So I ask, last remarks, who is this hurting and who is this helping? Thank you, Mr. Speaker.
The gentleman on the 19th, Doug Griffith, is recognized.
Thank you, Mr. Speaker. I'd like to speak to the bill. And as a pharmacist, we get a lot of continuing education hours, and it's very valuable to our understanding of the profession, but also, especially during this time of COVID, it's extremely important that we have a means by which we can educate anyone who's in close contact with a customer or a patient, be fully informed. And I think that the continuing education in this profession would allow a better communication of important factors that individuals need to know as they practice their trade. Thank you, sir.
The gentleman from the 45th, Doug Martin.
Thank you, Mr. Speaker. Would the chairman please yield?
Yes.
Thank you, sir.
Good morning.
So if I was a barber, would I be able to continue education anyways, even though I'm not required
You are
to?
free to read in America, yes.
Wonderful. Thank you very much. Thank you, Mr. Speaker.
The gentleman from the 32nd, Doug Fast, is recognized.
Thank you, Mr. Speaker. First of all, there was a statement made that the CEs in this matter provides education on human trafficking, and then it was followed up by a majority of people in this chamber don't care. Mr. Speaker, I have to differ with that. I think every human being in this chamber cares about human trafficking. Secondly, Mr. Speaker, I don't believe human trafficking is the fulcrum of continuing education for barbers and cosmetologists. Third, Mr. Speaker, I also received some communication from a barber back home, and basically he said that if the CE was proven to be more beneficial or hands-on for each individual profession, such as barbers, cosmetologists, nail techs, etc., then I would say it would be worthwhile. Bottom line is, he said he would be okay with no more CEs. That's some feedback from the people who's actually in the field, well-seasoned barber. They know what they're doing. And, you know, as an attorney, would I weigh in and say, I don't think we should have continuing education for legal practice? I'd say no. But every profession is not the same. So that being the case, Mr. Speaker, I would urge passage of the bill.
Lady from the 49th, Douglas Summers.
Thank you, Mr. Speaker. I want to speak in favor of the bill. In doing my job, I actually reached out to my hairdresser, and she is doing cartwheels that this is going to be gone. I don't know if your profession requires CEs or not, but in my profession, the government tells me even what my CEs are going to exactly be. I don't even have the choice to say, I'd like to learn more about strokes this year or something of that nature. I have to do what the government tells me to do. So my hairdresser is very happy with this, and I support the bill.
Lady in the 51st, Doug Fleshauer, is recognized.
Thank you, Mr. Speaker. I want to echo what the gentleman from Wayne said and the lady from the 51st. I can't imagine 2 hours every other year, which I think was the requirement, is not onerous. And the purpose of continuing education is very much to protect the public. We are having constantly changing rules about how to stay safe. And one of the last professions to be opened up was cosmetology and barbers. I just can't imagine why we would do this right now. I think most of us have learned a lot during this pandemic. We actually have practically eliminated the flu because we're wearing masks. And we don't know about these new variants. That is something that when I go to my hairdresser, or when those of you who use a barber go to your barber, won't you want to know that that person has been trained to make sure you're safe, to protect the public? That's why we have many of these regulations. That's why we have regulations in mine safety, for example, to prevent harm. And I repeat that question, who does this help? Who does it harm? I don't want to be the one who might be harmed by getting COVID, or I don't want it to happen to anyone in my family. So I urge rejection of this bill.
The gentleman from the 6th, Delegate Kelly, is recognized.
Thank you, Mr. Speaker, and good morning, everyone. You know, when we have a bill, we consult the experts. My phone exploded when this debate started. My wife is an expert in this field. For 50 years, she's been cutting hair, and she cuts my hair. And the point I want to make is this. When you want to know what's going on, you consult the experts. I haven't run into a barber or a cosmetologist that says, oh, this is a terrible idea, we've got to continue this education. Now, understand this. When a cosmetologist or a barber isn't working, they're not getting paid. It stops. So it's important for us to understand that. My wife also indicated to me via text that in the 50 years that she practiced cosmetology, the sanitation requirements did not change. They're still teaching the same things over and over and over again. So it's redundancy. Ladies and gentlemen, I'm amazed sometimes at the debates we get into on the floor. This makes sense. I support the bill, and I urge you to do as well.
Are there other members who wish to speak to pass the bill? The gentleman from the 10th, Delegate Conley, is recognized.
Thank you, Mr. Speaker. I rise in support of this bill. You know, I'm just totally and constantly amazed when we hear COVID-19 in every aspect of every conversation. It's been something that's been very serious, and I'm going to speak from the opposite side of it. I had COVID. I laid in the hospital for 11 days, part of that in ICU, not knowing if I was going to live or die. So I can speak first-handedly to this. I can also say that when I go to my barber shop, I see the due diligence that he's doing with cleaning, and he does it every single time. I see when I take my grandson to the barber shop, the due diligence that they're doing every single time. And I, for the life of me, don't know how you train anybody to be more sanitary than what these people are. So I think we just need to use a little bit of common sense here. And for that reason, I totally support this bill.
The gentleman from the 29th, Delegate Steele, to close debate on the bill.
I really didn't see this one coming. I mean, we literally passed paycheck protection. Somebody voted the wrong way without talking about it, and here we are on sanitation. Oh boy. You really got to pick where you throw your grenades this year, I
Gentleman,
guess.
please restrict his comments to the bill.
Yes, Mr. Speaker. 25 states have absolutely no continuing education requirements for barbers and cosmetologists, including Kentucky, Virginia, Maryland, Pennsylvania, and California, where they regulate plastic straws, but not barbers and cosmetologists. I do not see a massive COVID outbreak coming because your barber didn't read about how alcohol worked on razors this year. I don't see that coming. This bill is going to help the folks that are in the industry. I thank the gentleman, Delegate Kelly. I don't remember your number. Sorry. But you know, it's stories like that from mom and pop, you know, people running a small business in West Virginia. And I meant when I said earlier, who's this bill for? It's for the people of West Virginia. It's for the people that are trying to start a business, trying to run a business. You know, as he said, you're taking time out of your day. You got to think about these things. If you don't get them done in time, or you've missed a date, now you're going back. You got a suspended license. You got a notice or something in the mail, and it's a lot of hassle. What we're trying to do here is get rid of hassle in running your business. That means we got to run a bill on barbers and cosmetology every once in a while. That means we got to run a bill on a few of these other occupations every once in a while. And while it can feel tedious, that's our job in here. That's our job in here, is to listen to these folks. What have we always said? We're here to make West Virginia a better place to work, and this is part of it. It's that little thing that we can do to help you increase your business, help your stuff go in the right direction, and help you be more efficient. And if we can do that with this bill, and I think we are doing that with this bill, I'm proud to support it, and I'm proud it came out of our committee. And I would like to thank everybody who worked on that in committee and out here on the floor for your help with that in making West Virginia a better place to work. Thank you, Mr. Speaker.
The question before the House is, shall the bill pass? Those in favor of passage will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 84 ayes, 13 nays, and 3 members absent and not voting. Majority of members having voted in the affirmative, the chair declares the bill passed. The clerk will please report the title.
Committee substitute for House Bill 2325, removing the requirement of continuing education for barbers and cosmetologists.
Are there amendments to the title? If not, the title as read by the clerk will be and remain the title of the bill. The clerk will please communicate the action of the House to the Senate. Request concurrence therein. Next bill on third reading.
House Bill 2366, requiring agencies who have approved a proposed rule that affects fees or other special revenues to provide to the committee a fiscal note.
Are there objections to having the bill explained in lieu of having it read? There are no objections. The gentleman from the 29th, Douglas Steele, to explain the bill.
Thank you, Mr. Speaker. The purpose of this bill is to require agencies proposing rules that adjust any fees include a fiscal note provided to the committee that provides the fund name of their fee account, the fund number, and the past 5 years of actual revenues and expenses for that board or agency. And Mr. Speaker, we urge adoption. Thank you.
The question before the House is, shall the bill pass? Are the members who wish to speak to passage of the bill? If not, those in favor of passage of the bill will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 97 ayes, 0 nays, and 3 members absent not voting. A majority of members having voted in the affirmative, the chair declares the bill passed. The clerk will please report the title.
House Bill 2366, requiring agencies who have approved a proposed rule that affects fees or other special revenues to provide to the committee a fiscal note.
Are there amendments to the title? If not, the title as read by the clerk will be and remain the title of the bill. The clerk will please communicate the action of the House to the Senate. Request concurrence therein. Are there further bills on third reading? If not, bills on second reading.
Committee substitute for House Bill 2008, amending requirements for licensure relating to elevator mechanics, crane operators, HVAC, electricians, and plumbers.
Are there amendments?
Delegate Chris moves to amend the bill. This is HFA Chris 2-19, number 1.
Are there objections to having the amendment explained in lieu of having it read? There are no objections. Chair recognizes the gentleman from the 10th, Chris, to explain the amendment.
As the gentleman from the 30th tried yesterday, I'm asking that we drop the crane operators from this bill. As the gentleman from 30 talked about his profession yesterday, this gets in my wheelhouse. My family business of almost 80 years, third generation. We are in the river servicing business. We deal with cranes on a daily basis. We would like to have the same opportunities as the doctors and the lawyers, the engineers. to be able to do our thing without this bill. Currently, under licensing, there's almost 1,700 licensed crane operators. 975 of them are from out of state already. So that leaves about 724, 25 that are in state. We would appreciate the opportunity to continue to do that. And I ask for your vote, and I ask for a roll call. Thank you.
The question before the House is the amendment as just explained by the gentleman from the 10th. The gentleman from the 15th, Douglas Foster, is recognized.
Thank you, Mr. Speaker. And I would oppose this amendment, and there's a multitude of reasons why. So crane operators. So there's licensure for crane operators. What the gentleman didn't mention is there's also OSHA certification and testing every 5 years for crane operators that you have to do right now. So that OSHA certification is listed in this bill. It's 29 CFR 1926.1427. And they do that certification. They have to take a test every 5 years. And OSHA introduced that in 2018. And the reason for that, the reason that only 18 states actually have a crane certification. So the significant majority of states do not have a crane operator's certification license. And when that is the case, also, they're doing 2 tests. So they're going and doing the West Virginia side and the OSHA federal regs. And we actually spoke with the Division of Labor about this because we were wanting to talk about it, and there was an amendment included in the rule as well. Because just to make abundantly clear that, as suggestion from the Department of Labor asked us, the Division of Labor said, well, what we will do is with our current enforcement. So we will enforce for OSHA, the federal OSHA, and we can enter into a contract and get paid for it. So right now, they will our Department of Labor will continue the enforcement for OSHA. If this amendment passed, the only difference is you all will be paying it. The crane operators will be paying it. West Virginians will be paying for it instead of getting the federal government to pay us to do their enforcement. And this license is not something that should be required if you're already going through the expense of doing all the testing and going through the OSHA regulations, which is included in this bill. So, Mr. Speaker, I would urge rejection of the gentleman's amendment.
Are there other members who wish to speak to adoption of the amendment? If not, does the gentleman from the 10th wish to close debate on the amendment?
Thank you, Mr. Speaker. We do have an annual inspection by OSHA on our equipment and our operators every year because we work over water. And therefore, that inspection happens every year. And that's a very expensive inspection that we pay for as the owner and the operators of this equipment. Again, all I'm asking is that we get the same consideration as the other professions that have been excluded. Thank you, Mr. Speaker.
The question before the House is the adoption of the amendment. A roll call vote was demanded. Is the demand sustained? Demand is sustained. Question is, shall the amendment be adopted? Those in favor will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 57 ayes, 40 nays, and 3 members absent not voting. Majority of members having voted in the affirmative, the chair declares the amendment adopted. Are there further amendments?
Doggett Desario moves to amend the bill. This is HFA Desario 2-19, number 1.
Does the gentleman wish to explain the amendment in lieu of having it read? Are there objections? There are no objections. Gentleman is recognized to explain the amendment.
Yes. Once again, this I brought it up yesterday. This is E-Verify. We would like to do this in the electricians' end of the licensing because we see a lot of falsification here. We were told yesterday that this would cost money. E-Verify is an electronic, free system. It won't cost us any money. We were told that there's already procedures in place, such as an I-9 form. But I'm here to tell you today, if you have an unscrupulous contractor, it is nothing for him to take a false identification and sign off on that piece of paper. If he's going to hire him, why wouldn't he do that the same way? So it's not going to cost us any money. It's not going to... Excuse me, I lost my place for just 1 second. And I'd like to share a couple things for you. A couple newspaper articles. November 19th, 2019, 4 people arrested while attempting to become licensed electricians. October 9, 2020, suspected illegal aliens arrested after attempting electrician's exam in West Virginia. So it's happening. If we're going to make things easy for people to come to our state and work, take the licenses for wherever they come from, let's please make sure that our West Virginians get jobs before we can give it to the people that we don't even know if they have citizenship in this country. It's easy, and I ask for the yeas and nays. Thank you, Mr. Speaker.
The question before the House is the adoption of the amendment, as just explained by the gentleman from the second. Are the members who wish to speak to adoption of the amendment? The gentleman from the 15th, Douglas Foster, is recognized.
Thank you, Mr. Speaker. And to clarify, this is amendment number 1, sir. All right, and this is an E-Verify amendment. We talked about this just a little bit the other day, an amendment that failed in a previous bill. So what's going on here is the amendment is essentially just trying to add another regulation on top of the fire marshal's office. So right now, I-9 forms accomplish this in every business. Everybody that hires an employee completes an I-9 form to accomplish this verification of eligibility for employment, as in saying that they are a United States citizen. Well, what this bill does is, or this amendment does, would be to say that they also have to E-Verify, but it puts it on the onus of the board. So now your fire marshal's office is going to have to end up collecting I-9s and doing an E-Verify on employees that are already verified through the I-9 form by the employer. So it's putting a huge onus on top of the fire marshal's office, as well as something that is already completed through an I-9. So I would urge rejection.
Are there other members who wish to speak to adoption of the amendment? Does the gentleman wish to close debate on the amendment? If not, the question before the House is adoption of the amendment. Roll call vote was demanded. Is the demand sustained? Demand is sustained. The question is, shall the amendment be adopted? Those in favor of adoption will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 31 ayes, 66 nays, and 3 members absent not voting. Less than a majority in the affirmative. The chair declares the amendment lost. Are there further amendments?
Delegate DeSerio moves to amend the bill on page 26, section 6, lines 23 through 25, on line 23, by striking out the colon and inserting a period, and striking out the proviso on lines 23 through 25.
The question before the House is the adoption of the amendment. Are there members who wish to speak to the amendment? The gentleman from the 15th, Douglas Foster, is recognized.
Thank you, Mr. Speaker. I would oppose this amendment as well, and I'm surprised that it was offered. Here, the last 3 years or so, we've taken it on ourselves to say, well, we want to remove barriers to employment. We passed a bill out of here, and many may remember the term rational nexus. So a rational nexus to your licensure. So we didn't want people being disqualified because of terms like moral turpitude and good moral character. So what we did is pass rational nexus language that said that people were allowed into a profession even if they made a mistake in the past. And we wanted to do that,
And when we did, it allowed people that had a minor misdemeanor or something on their record to still get a license and still work. Well, this one's specifically to the fire marshal, and this is specifically to just the fire marshal, and saying that the fire marshal no longer has discretion. And let me explain to you how that would pan out. Because I believe somebody who made a mistake in their past, and this is talking about violent crimes and sexual offenses. Yeah, that sounds bad. And the fire marshal right now can deny a license for any of that. Well, what the gentleman is saying is there can be no discretion. So if somebody made a mistake in their past and let's say they got in a fight with somebody after school and got an assault charge on their claim, well, you can no longer be a licensed fire sprinkler installer, electrician. That's completely preventing the ability of somebody who made a mistake when they're 16 years old to become licensed. And we've already done this in rules. It's gone through all the rules in many areas. So the amendment would do is effectively take the ability of the fire marshal to say, hey, it was a small mistake. It shouldn't have happened, but we will still allow you to work in this state. And what I don't want to do is go to the point of we're just, with this amendment, excluding everybody no matter what the circumstances. So I would definitely urge rejection of the amendment and urge everybody to do the same.
Are there other members who wish to speak to adoption of the amendment? If not, those in favor of adoption will say aye. Roll call vote is demanded. Is the demand sustained? Demand is sustained. The question is, shall the amendment be adopted? Those in favor of adoption of the amendment will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result. On that question, there were 28 ayes, 69 nays, and 3 members absent not voting. Less than a majority in the affirmative. The chair declares the amendment lost. Are there further amendments? If not, the bill will be advanced to third reading. Next bill on second reading.
House Bill 2253 relating to forgery and other crimes concerning lottery tickets.
Lady from the 49th.
Thank you, Mr. Speaker. I ask unanimous consent to move the bill to third reading with the right to amend.
Lady from the 49th asks unanimous consent that House Bill 2253 be advanced to third reading with the right to amend. Is there an objection? There are no objections. The bill will be advanced to third reading with the right to amend. Are there further bills on second reading? If not, bills on first reading.
Committee substitute for House Joint Resolution 1, Supervision of Free Schools Modification Amendment.
Resolution be advanced.
Committee substitute for House Bill 2260 relating to procurement of child placing services.
Bill to be advanced.
House Bill 2500, create an act for statewide uniformity for auxiliary container regulations.
Bill to be advanced. Are there further bills on first reading? If not, leaves of absence. Lady from the 49th.
Thank you, Mr. Speaker. For our colleagues, Delegate Linville, Kessinger, and Ellington.
Are there objections to leaves being granted? The chair hears no objections. Leaves shall be granted. Introduction of guests. Miscellaneous business. Lady from the 38th, Delegate Graves.
Thank you, Mr. Speaker. I would ask that it be recorded in the appendix of the journal that I intended to vote in the negative on 2009. I got carried away with all the green button pushing.
Lady wishes that to be recorded in the appendix of the journal. Are there
maybe
objections?
not the green button pushing, but that I intended to vote in the negative on Bill 2009.
Lady will please file that with the clerk.
Will do.
Gentleman to 66, Douglas Espinosa.
Thank you, Mr. Speaker. A few unanimous consent requests. I would ask unanimous consent that the remarks from the gentleman from the 13th on House Bill 2003, the lady from the 49th on House Bill 2325, the junior lady from the 51st on House Bill 2325, and the gentleman's remarks from the 10th on House Bill 2325 be placed in the appendix of the journal.
Are there objections? There are no objections. Other miscellaneous business? If not, lady from the 49th.
Thank you, Mr. Speaker. I move subject to announcements that the House adjourn until 11 a.m. Monday, February 22nd.
Are there announcements? Gentleman the 10th, Doug Chris.
Thank you, Mr. Speaker. Your Committee on Finance will meet this afternoon for a budget hearing from the Supreme Court of Appeals in the House chamber. Thank you, Mr. Speaker. Excuse me, the time will be at 1:30.
Gentleman, 30 seconds, go fast.
Thank you, Mr. Speaker. Your Committee on Judiciary will not meet this afternoon, nor will it meet Monday morning. Your Committee on Judiciary will meet 4 p.m. Monday afternoon, Government Organization Room. The agenda will be posted.
Gentleman 13th, Doug Higginbotham.
Thank you, Mr. Speaker. Your Committee on Education will meet today, this afternoon at 2 p.m. in the House of Delegates chamber. The agenda is posted. In addition, we will be meeting on Monday, February 22nd at 1 p.m. in the House chamber, and the agenda will be posted.
Gentleman 15th, Doug Foster.
Thank you, Mr. Speaker. Your Committee on Government Organization will meet on Monday, 1 p.m. in the Government Organization Committee room. Agenda will be posted.
Are there further announcements? If not, the question before the House is the motion by the lady from the 49th that the House stand adjourned until 11 a.m. Monday. Those in favor will please say aye. Those opposed, please say no. The ayes have it. The motion is adopted. The House is adjourned until 11 a.m. Monday.